Good morning, everyone. Welcome to our 7th annual Cancer Survivorship Symposium. My name is Kristen Fazzolero, and I have the privilege of leading the Hoag Cancer Support Services team. And we are really excited to have you join us today and to bring you what we hope will be very informative and fun information for you. We've built in some time for questions at the end of each session, so go ahead and type your questions into the YouTube chat box as we move through the presentations. And if by chance we don't get to your question, rest assured that we will go ahead and send you a response to that via email through your registration contact information at the end of the event. You've each received a really lovely, specially curated box that includes a lot of fun goodies, along with information about our support services and how to access different offerings at the Cancer Center. And we do have a fun interactive session set up to close the day. So you'll want to stick with us and stay tuned because there's actually an exciting raffle prize that will be announced during that final session. We will be taking a break right before that final session and encourage you to grab a snack or get some lunch, as we know it's a long morning of information. And I really would just like to thank our planning committee. So Marie Meow, our social worker here at the Cancer Center, led this effort to bring everybody together, along with our CorpCom team and all of the fantastic speakers and philanthropic donors who allow us to bring this event to you every year. Finally, we want to say an extra special thanks to Spa Gregory's, as they definitely gave a generous donation to include in your goodie boxes. So we hope you have fun with that. Without further ado, I'd like to go ahead and introduce our first speaker. Dr. Renee Garcia is the Director of Hoag Psychiatry Consult Service and chair of the Neurology and Psychiatry Department. She has an amazing background of experience practicing psycho-oncology up at Stanford's South Bay Center in Los Altos, California, and we're excited to have her speak with you today. Enjoy.
Hello, everyone. I'm really pleased to be here and to talk to you all about a very, very important topic, especially to me as a psychiatrist. And with further ado, let's jump right into this big topic of distress. If you can go to the next slide, please. Next slide. I have nothing to disclose. Next slide. So I want to spend a quick second just going over objectives for our discussion today, primarily to give you a sense of what content we're going to cover and also just to kind of keep me on track. So the first thing we're going to focus on is defining the term distress in the setting of cancer survivorship, as well as discuss most common types of distress and the associated symptoms of each of those different categories. We'll discuss options if you are experiencing some of the symptoms. What are the ways in which you can get screened, get further assessed, and potentially come to a point of getting a diagnosis so that you could, of course, get recommendations at that point. Review commonly used treatments, as well as we'll touch a little bit on how important lifestyle changes are to alleviate distress. Next slide, please. All right, so if you go to any cancer-focused group, the one that I've referenced many times is they have very great guidelines available for both patients and clinicians. The National Comprehensive Cancer Network, I am a member there from my time up at Stanford doing psych-onc, but this is a very all-inclusive, comprehensive diagnosis or description of distress. It is quite wordy, and it is a multifactorial, unpleasant experience of psychological, social, spiritual, and or physical nature that may interfere with one's ability to cope effectively with cancer, its physical symptoms, and its treatment. Now, they describe that distress extends along a continuum ranging from common kind of normal feelings of vulnerability, sadness, and fears to problems that can actually extend on to be more disabling, such as depression, anxiety, panic attacks, social isolation, and then, of course, just given the context of dealing with cancer and cancer survivorship, existential and spiritual crises also. Next slide. Now, with that, that very all-encompassing description is great, but really, what does that mean? It's a normal, expected experience. Patients and yourself as survivors have lived through the distress of hearing of a cancer diagnosis, going through the treatment, and now being in survivorship, you understand that distress kind of comes along and occurs in parallel. For many, it comes at different times, okay? And the severity of the distress can range from being very mild to more severe. And what I really want to emphasize is that it really can occur at any point in someone's cancer journey, whether that be from the time of diagnosis or after the fact if they're dealing with fears of recurrence. Now, most survivors' distress levels and symptoms will not meet criteria for a major psychiatric disorder that would, I myself as a psychiatrist would diagnose using the DSM, okay, which is the Diagnostic Statistical Manual. And symptoms can vary, and most commonly, though, they'll include anxiety, depression, fear of recurrence, as well as trauma-related. And we'll talk a little bit more about the trauma-related disorders, but by virtue of just going through a cancer experience, and depending on how rigorous your treatment was, or that you still may be going through, it can be a trauma, and medical trauma is something that is very much recognized in the field of psychiatry, especially my specialty field of consultation liaison psychiatry, where we interface directly with the medically ill. That medical trauma is very real. And many cancer patients do deal with that as part of their treatment. Next slide, please. Types of distress. So like I mentioned before, the most common ones are depression, anxiety, fear of recurrence, and then trauma-related issues. So, whether you look at the American College of Clinical Oncology or you look at the National Cancer Comprehensive Network, they all will recommend routine distress screening at regular intervals, or if there's any change in your clinical status, okay? And that's just as simple as transitioning from maybe first cycle to a second cycle. Sometimes even in between, we have to take those moments and pause, recognizing that distress can occur at any point on the continuum of your cancer journey. So typically, now most primary care offices and oncology offices, because of these recommendations and because they want to catch distress if their patients are experiencing it, will commonly ask these types of questions, okay? And so I wanted to go over these with you all so that you can each kind of maybe pause and think about it for yourself. So anxiety, the ones that they focus on most commonly for patients with cancer is, have you had in the past 2 weeks, on more days than not, have you had worries or fears related to your cancer? Felt nervous or worried, or even about other things, to where your anxiety is now extending beyond your cancer to other things. And of course, as you all being survivors know, that cancer never just stays in that medical lane, right? Of course, it ends up impacting other areas of your life. Have you had any trouble controlling your worry? All of these symptoms are what have been shown to be common in cancer patients. And it's very sensitive and specific. So that's for anxiety. Let's move on to depression. So with depression, you deal with kind of 2 core symptoms, and that's what these questions focus on. In the past 2 weeks, more days than not, have you felt sad or depressed? Or number 2, had less interest or enjoyment in activities that you used to do. Let's say you loved gardening and that was what you looked forward to when you got time for that. If there is a component of depression, you just don't really enjoy it. You go out there, you might keep yourself occupied for a few minutes, but end up just going inside. And it just doesn't bring you that same level of enjoyment and lift your mood. Now, with regards to trauma, the most common symptoms are, in the past 2 weeks, on more days than not, have you had nightmares or thoughts about your cancer, your treatment, or other effects that you did not want to? And number 2, tried hard not to think about events or effects related to your cancer, and then went out of your way to avoid situations that reminded you of those events. Now, these three symptoms hit all the core clusters of trauma-related disorders, which we'll go into much more in depth. But I wanted to at least give an overview as we go and do a little bit of a deeper dive into different symptom clusters. You can go on to the next slide. Now, the most common diagnosis, knowing that many cancer patients, cancer survivors, won't really rise to the level of meeting criteria for major depressive disorder or a formal anxiety disorder, or maybe even post-traumatic stress disorder. But many patients in the context, I mean, we're social beings, we are emotional beings, we will have emotional responses to very intense changes in our lives. And so as one normally would experience a emotional reaction to dealing with cancer and its treatments and its effects. So that's what adjustment disorder really encompasses. So an adjustment disorder occurs when an emotional or behavioral symptoms develop in a response to an identifiable stressor, a loss, or a trauma. Okay, and I think you can consider cancer hitting all three of those. And this diagnosis, as I mentioned, is commonly used for those who are experiencing distress, because sometimes it doesn't fit into just one category. Many patients who are experiencing depression also have some level of anxiety, and vice versa. And so insomnia, fatigue, those things also can very much bring on mood changes. So adjustment disorder can cover the entire spectrum, okay, because many people cope with stressors or loss or trauma in different ways. And so what doctors have done to kind of help communicate with each other about what this symptom might be experiencing, what this patient may be experiencing, is to give these little descriptors. So an adjustment disorder with depression, anxiety, of course, the mixed anxiety and depression. For some individuals, disturbance of conduct. And so you will see someone's behavior change. For example, they just start, going out and wanting to party or to go to bars, or they're now, doing extramarital relationships. So it would be something that would be considered in a way maladaptive, but it's a person's means of trying to cope and to control their environment in a way that they can, maladaptive or not. And of course, you can have those who have a disturbance of both mood and conduct, so they can have a mix of those types of symptoms. And unspecified is, I mean, like I mentioned, there's a whole spectrum. People will deal with things in different ways. And so maybe something that doesn't fit into any one category can be labeled as an unspecified. Can go on to the next slide. Now we'll talk a quick second about anxiety. General anxiety symptoms. There's even a disorder called generalized anxiety disorder, but these are really just many of those types of symptoms that don't always have to occur in the context of a formal disorder. So excessive anxiety and worry, that is difficult to control. So despite your best efforts, your anxiety continues to bubble up to the surface. And you find yourself talking about it again, or you find yourself, getting distracted from what you're trying to do because of that worry. And as anxiety is a very stressful, tense state that it takes a lot out of you, and it leaves people to feeling very easily fatigued. You can kind of start the day very stressed, and by the end of the day, your energy level is crashing. You're just feeling that you just don't have any more gas in your tank, if you will. Difficulty concentrating, or if you're trying to do something and your anxiety pops in your mind, and then you're losing your train of thought. You may be in a context of a discussion and something triggered a worry, and then your mind goes blank. Muscle tension, as one can imagine, that goes with anxiety. Sleep disturbance, that inability to kind of sit and relax so that your body can be at peace in a calm state so that you can fall asleep. Now, panic attacks is also something that can be coupled for many cancer survivors. They're very, very distressing. It's a sudden onset of intense fear coupled with physical symptoms, okay? And again, Everyone's panic attacks can vary slightly. And so what you'll see here is a list of common physical symptoms. If you've had a panic attack and something you've experienced wasn't on that list, it doesn't mean that it wasn't a panic attack. It just means that your panic attacks maybe just included a less common symptom, if you will. But the most common of them is palpitations, pounding heart. You get very sweaty, kind of clammy, trembling and shaking. That's a very, very common one. A sensation of feeling like you can't catch your breath, you're being smothered, chest pain and discomfort, which, as one can imagine, shortness of breath and chest pain, many people who have panic attacks actually end up in the emergency room for fear that something catastrophic physically or medically is happening. Nausea or abdominal distress. Sometimes people can have diarrhea, loose stools afterwards, just by pure intensity of that stressful event. Feeling dizzy and lightheaded, chills and heat sensations where you feel like your temperature is fluctuating all over the place. Fear of losing control or dying. If I could, I probably should have put a star by this one. I feel like the intense fear coupled with fear of losing control and dying, that sense of impending doom, are intricately connected with panic attacks. And then feeling detached from oneself. And feeling detached from oneself, I think a lot of people will liken that to floating above your body, or feeling as though you're not able to sense all of the normal senses that your body experiences to give you a full impression of what your environment is. And so those are just the general description. So, if you're experiencing general anxiety symptoms, that if you're experiencing more than 4 or 5, then that would put you more into the severe range. Now, panic attacks, how we kind of rate those with regards to severity is how often they're happening. Having a panic attack once a year, of course, it's very distressing, very appropriate term to use, but it also, isn't disabling in the same sense as if you're having panic attacks every time before you go to treatment. I have to go to the infusion center, and you know that you're going to have a panic attack. And these are things that you should not have to suffer through. Your doctor can help. And so again, make sure you talk with your doctor, but these can be very disabling if you're experiencing them on a regular basis. Sometimes, and if you look at the DSM, they will tell you that panic attacks classically come out of the blue. But when someone is dealing with such an intense emotional, psychological, and physical experience as being and dealing with cancer and its treatments and its survivorship, it can be brought on and it can be triggered by certain things. And it's really good to be mindful if you can identify what those triggers might be. Next slide. Now, depression or depressive symptoms. Now, sometimes when symptoms of depression progress in severity to the point of where it's impacting someone's ability to function, okay, get out of bed, take care of household events, shower, check your mail, pay your bills, basic things like functioning, and induces significant changes in emotion, behavior, and thoughts. Okay, depression, when in its severest form, can go on to major depressive disorder. Okay, and major depressive disorder is quite functionally impairing, and there are lots and lots of treatments that have been shown to be very, very effective. Okay, and so the symptoms for major depression, or just of depression umbrella in totality, typically we talked about this in the initial kind of screening distress questions, but there are 2 core symptoms to depression. For many people, there's just the intense feelings of sadness, despair, or depression. On the other end, there's this lack of pleasure where your mood no longer responds in that normal way. I can do something that I know I love and I'm going to feel better after the fact. If you lose that ability to have that mood respond and elevate, that is, concerning for depression. And oftentimes I think about it as, depression, some people get that sadness, some people just don't get that ability to experience joy. Both of them are equally treated the same and both be treated effectively. Now, when it becomes significant and depression starts to affect the body responds in physical ways. So it can affect your appetite, sleep disturbances. The classic sleep disturbance for depression is early morning waking, typically 3, 4 a.m. and inability to go back to sleep. But that's not the case for everyone, especially if you have significant anxiety. Sometimes that wind down can be difficult. Sometimes people just wake up multiple times in the night. And so additionally, depression can affect your psychomotor status. So what that is just feeling, if you've ever had that intense feeling of restlessness, you just feel really on edge and you can't really sit still. So that's that psychomotor agitation, this restlessness. And then there's retardation, which is this feeling of slowed down, that despite everything you're doing, things are just moving so slow. And no matter how much effort you put in, you can't get your body to move any faster. It feels very heavy and weighed down. Feelings of worthlessness, excessive guilt. Typically, the patients will say that they feel like a burden on their family. Diminished concentration. Okay, it's very hard to focus. So, like for example, if you're reading something, you find that you're reading things over and over again, and you just can't maintain that concentration. That's also a symptom of depression. Negativity. Okay, so feeling negative about oneself, the world, and the future is the classic triad of negativity in the setting of depression. And then, of course, thoughts of death, hopelessness, and suicide. Okay, anytime you experience these, you should be either calling a suicide hotline, getting on the phone with a family member, or getting yourself to the emergency room. Okay, there is help out there. And the most important thing above anything else is your safety. Okay. Now, like I mentioned, there are many treatments for depression, some medication and some not, which we will end with at the end of this presentation. Next slide, please. So next topic we're going to talk about is fear of recurrence. Okay, this is, again, I can emphasize big red flashing lights. This is a normal, expected experience for cancer survivors. We all have that normal ability to assess risk, right? You get in the car every day, you drive, you know that you have a risk of a car accident, but you can kind of logically weigh that risk that it's very minute. You haven't had a car accident. As long as you're safe, you take what you do, what's in your control. Typically, we can kind of settle that anxiety down and we can kind of move forward. But in the setting of cancer, you're living with cancer. And of course, everyone's cancer survivorship and stage of cancer or remission status, of course, is going to be different for everyone. So being able to assess that fear of recurrence is different for everyone because their likelihood of recurrence is different. And at the same time, that fear of recurrence in some people is adaptive in some ways, and that it keeps them focused on wanting a healthy life and wanting to make changes and things that are in their control. But at the same time, there's also the negative aspects of fear of recurrence where, people are just marked by just anxiety. They're fearful of doing anything. They're fearful of going to their appointments. They're fearful of treatment. They're just so fearful that they end up sabotaging themselves in a lot of ways. And of course, that is the severe form of it when it becomes impairing and functionally impairing. Okay. Now, many patients, especially survivors, after they've completed an intensive course of multiple cycles of chemo, radiation, or surgery, during active treatment, it's all hands on deck, right? Everyone is there. And of course, you usually have the support of your family. And once, treatment is done and you kind of have transitioned to the next phase of monitoring, maybe not considered an active treatment, many patients feel alone. They feel a sense of abandonment because after all that support, it's just drawn away and say, okay, we'll see you in a month. We'll see you in 6 weeks. And things are being spaced out more because things are looking good with regards to your cancer. But that doesn't mean that all these other effects, okay? And, a lot of what's going to be focused on today is going to be the different experiences of people who are in the survivorship. And there are many ways to kind of help support yourself during that time, okay? But this is a common feeling. So if you felt that way, you're not alone. And, you know, fear of recurrence, because if it's occurring in the setting of cancer, many patients become very hypervigilant and very attentive to any physical sensation. If you happen to have a gastrointestinal cancer, if you have a flu, or you have food poisoning, or you just have something that upset your stomach, those little things can stay with you, and they can induce a lot of anxiety. They can induce panic attacks. They can induce other generalized anxiety symptoms. They can induce depression because you're not able to do the activities that you want to anymore, or you're fearful to go out and see your loved ones. It can start ballooning from there. Okay. So again, talk with your family, talk with the people around you, talk with other cancer survivors, because you're not alone in this. And I want to make sure that I emphasize that. Okay. Next slide, please. So now let's kind of go on to the trauma-related disorders. Okay. And I say trauma-related disorders, but really it's post-traumatic stress. There's something called acute stress disorder, which I really didn't put in there. It's not something that has been extensively studied in the setting of cancer patients. But many patients do experience adjustment disorder, which we've gone over before. It is, if you look at the DSM, it does fall under the umbrella of trauma-related disorders, given that it's triggered by a loss or some type of trauma. But post-traumatic stress is, if you will, the severe form, the disorder that is associated with trauma-related symptoms or distress, okay? And PTSD, we will use that because it will cover all the symptom clusters, okay? Now, not everyone, and like I said before, most cancer survivors will not meet criteria for any significant psychiatric disorder. However, the symptoms remain the same, okay? And so that's how we identify that they fall in to be trauma-related, okay? And so the first cluster is re-experiencing symptoms. So this is, you're doing your normal day-to-day and you're having intrusive memories of your surgery, your recovery, how you felt after chemo and how intense the nausea was. Whatever it was for you that stuck with you, having those memories come back. Nightmares for many people, where they wake up. Sometimes it doesn't always rise to the point of waking them up, but they remember in the morning. But the classic is, of course, nightmares that wake you up from sleep. You wake up, you're sweaty, you're shaking, you're in this horribly distressed emotional state. And oftentimes it takes people a very, very long time to calm down enough to be able to fall back asleep. This isn't one that you're just going to kind of roll over and be like, whoa, that was weird, and then roll back asleep. It's very intense. And of course, flashbacks being the last of the re-experiencing symptoms. And a flashback, what makes it a bit different than intrusive memories or a nightmare is that it almost is a bit of a dissociative symptom. So you almost feel as though you're not in your environment and you're back where you were at the time that you went through that experience, which, as you can imagine, it sounds horrible, right? So a flashback actually feels like it takes you out of your environment and plops you right back where you were when you were going through that trauma. So as you can imagine, very distressing. You wouldn't be able just to kind of pick up your day and be able to move forward with that. Persistent avoidance is another symptom cluster. So avoidant symptoms are symptoms in which you will go to avoid any distressing memory, thought, feeling, or any external reminder related to your trauma or your cancer. Conversations, family with basic questions of just how are things going, can trigger you. You almost don't even want to be around family, because going there and feeling like the need to talk about it again is just overwhelming, and you would just rather avoid than to deal with that, just because it brings on so much stress and so much distress. And the third cluster would be negative alterations in mood and cognition. And so cognition is just a fancy term for thoughts. So you end up, people who have PTSD or have symptoms in this cluster experience an exaggerated negative belief about oneself or the world. We've all kind of in our lifetimes have encountered that negative person where it's just like, wow, no matter what you say, there's something, a negative response. Um, and, having one person who maybe, isn't in that space all the time, transition to that negative emotional state is commonly associated with it. Feeling detached or just estranged from others, the sense of numbness, feeling as though, for some, it's even that dissociation where you feel disconnected from yourself. You feel like the world that you're living is very different. A lack of positive emotions also. So that kind of also liken similarity to some of that depression symptoms. The feelings of fear, horror, anger, guilt, shame. I mean, that, handful right there, fear, horror, anger, guilt, and shame are pretty much the negativity that can kind of come with it. Okay. If you can imagine having those feelings all bubbling around inside of you, they would be very distressing. And then the last cluster will be hypervigilance. Okay. Feeling super alert and on guard that no matter, even if you're sitting on the couch and you can put your feet up, you can't relax. That difficulty concentrating, sleep disturbance, just feeling keyed up on edge that you can't wind down. Aggressiveness. Okay. If you can imagine you're on edge, you're constantly on guard, and then someone like life will throw you a curveball and boom, you're acting outside of your typical character. And for some people, aggression is their response. Some people, they, have a panic attack or they scream or they hide out. It's going to be different for everyone. Aggressiveness with that sense of hypervigilance kind of very much get coupled together. Risky or self-destructive behavior. Okay. Many, many times I see patients who have emerged from childhood trauma and are often very self-destructive in their behaviors and their relationship choices and their lifestyle choices. And in a way, people who have been traumatized and who are cancer survivors can also have that same thing kind of play out, right? In the survivorship, we want you to focus on healthy lifestyle and to do even just the small things that you can do to focus on health and on wellness. But if you're dealing with a significant trauma-related disorder, you're dealing with these symptoms, that self-destructive piece can just be living an unhealthy lifestyle, and that can have significant ramifications. We'll go on to the next slide, please. So if you are experiencing any of the symptoms that we talked about, I want you to really, really talk with your doctor, whether that be your oncologist, your primary care doctor, or if you have another disorder and you just really have a good connection with your doctor and you feel like you can be open with them, I would encourage you to go to that doctor, okay? Now, of course, if the decision at the end of it is to do anything with regards to formal treatment, make sure you let your oncologist know, especially if you're still dealing with intermittent active treatments or procedures or certain monitoring, okay? Basic distress screening is recommended, okay? And it should be completed at regular intervals. So the screening piece to you all shouldn't be new, okay? You probably have done this multiple times over, okay? And I hope that you're being honest and open when you're answering those questions, okay? But you will initially get those initial short little screens, 2-3 questions at most, that are meant to capture anyone who's dealing with distress, okay? And then that is meant to kind of, one, potentially spur further narrowed screening, okay? Or it would, spark a discussion with you and your doctor. Now, there are many different screening tests or questionnaires that are designed for identifying distress, lots of them, okay? If you look at the literature and oncology research, there are a few standouts, okay? And I'll go over a few of those on the next slide. And then in addition to the screenings and questionnaires can give, especially more the focused screenings, which usually happen after the initial, give a bit of a symptom severity. A positive screening for the initial for distress should be followed with a discussion, okay? And let's say you happen to go to your OB and you just not like your OB and you just feel comfortable with her, you can talk with her about it. But should you choose to start anything, please make sure you talk to your oncologist. And if you talk to your oncologist, Every doctor feels different in terms of their comfort level taking on distress treatment. They will work with you with the screening, and I promise you, they will encourage you getting support, but they may choose to refer you directly to someone, depending on where you get your hormonal treatment. If that's here at Hoag, I know that we have a lot of support from our social work, but there are also, different other therapists in the community as well as psychiatrists. So they may choose to refer you out. Next slide, please. So these are a few of the most common kind of initial screens, okay? So if you look at the one on the left, it's the National Comprehensive Cancer Network. They have this distress thermometer, and your doctor, it's meant to actually happen in the context of a discussion with your doctor. So in the context of having a discussion, you would have all of these questions answered, and it would give your doctor a sense of what your distress level is. That one actually is fairly new. Probably in the last handful of years. But if you look at the ones on the right, the top one is the PHQ-4, so the Patient Health Questionnaire 4, and the one underneath it is the PHQ-2, which is the Patient Health Questionnaire 2. The top one, the PHQ-4, hits on the two core symptoms of depression that we talked about, as well as it hits on two core symptoms of anxiety. So this one actually is a little bit nicer. I like the PHQ-4 a little bit better as a psychiatrist because it hits both anxiety and depression, and it hits some of the core symptoms that could easily spur a discussion or a focus, more narrow screening, so that treatment can be initiated from that point. Okay, next slide. I'm looking at time and I want to make sure I leave time for questions. These are the more focused screens, okay? The one on the left is the PHQ-9, so the Patient Health Questionnaire 9, okay? And essentially, this mirrors the diagnostic criteria for major depression, okay? And so it covers all of them, so it would allow your doctors to capture what symptoms you're experiencing. And it also would allow your doctor to assess how significant the symptoms are, how severe they are. And of course, down on the bottom, it always will screen for suicide. So if you put yes, even on several days, that will definitely start a discussion. And I want you to know that that's a good thing if you are feeling that way, that you're being open and that a discussion results from that. And then the right top is the Generalized Anxiety 7. So it's 7 questions going over the 7 diagnostic criteria for generalized anxiety. Again, recognizing that most cancer survivors will not be severe enough to meet criteria, but we want to be comprehensive with all the symptoms so that we capture what our patients are experiencing. Okay. And then the bottom one is the primary care PTSD. And so it hits on those different symptom clusters that we talked about, okay? And that one's definitely not diagnostic. PTSD in the formal sense is a bit, it's a number game a little bit. You have to get a certain number from each of the different symptom clusters, and I don't want you to worry about that. I want you to know and just think about that there are many different symptom clusters associated with those trauma-related distress symptoms. Next slide, please. So a medical evaluation. Okay, I have to pause to do this because I practice psych oncology. I know that any decision where you receive a mental health diagnosis, before that referral happens, before you start any medications, you have to have a discussion with your primary care or your onc. Okay, the reason for that is many of those symptoms that we described, both primarily in the depression, okay, but even in the anxiety, can, for certain cancers, can lead to anxiety, especially the feelings of shortness of breath. If you're dealing with lung cancer or you're a lung cancer survivor, those symptoms can't just be chalked up to something psychiatric, okay? You need to have a formal discussion with your oncologist, whoever is monitoring you at that time medically, to make sure those symptoms that overlap with depression and anxiety are not due to something else, okay? And they may do some additional testing, okay, because they want to rule out other medical conditions that can induce mood states like depression or anxiety. I'm going to use thyroid as an example, okay? There are many different cancer treatments that can impact the thyroid. If the thyroid is low functioning, it can lead to experiencing of depression, insomnia. So your doctor, depending on what your individual situation is, make sure that you identify any of those symptoms and you have that discussion first. And hey, why not have them be aware of it and have them facilitate a referral? Because maybe they know someone great. Next slide, please. So I know that we are going to go over this in many different ways for the remainder of this symposium. So for time's sake, I'm looking, I'm at 9:40. I have 10 minutes. So I'm going to say next slide. And I'm going to spend 5 minutes going over treatment options. Okay. And I really want you to, if we don't get to all of your questions, I want you all to rest assured I will make some time to answer all of your questions. Kristen and I will work together and we'll make sure all of those get answered. Okay. But many of the different treatment options that have been researched, and I'm talking about evidence-based practices or treatments that can be done to help people who are dealing with distress-related symptoms from cancer. Support groups is huge, okay? Talk with the staff here at Hoag, okay? I know that there are also other different community-based groups, cancer-based groups that offer support groups. So get support and give support. There's so much that one can gain from being there to support another. And maybe the person next to you had some really great tips that help them deal with their anxiety, and you can learn from them. And maybe that's something that makes a huge difference for how you feel and how your quality of life is. So support groups are huge. There are integrative therapies, okay? There are integrative medicine within oncology, okay? But that can be meditation, mindfulness, imagery, hypnosis, yoga. Those types of things have been shown to be very effective. Now, there's individual psychotherapy as well. And cognitive behavioral therapy, or CBT, is pretty much been studied, and I feel like everything. I mean, smoking cessation, insomnia, anxiety, depression, self-injurious behavior, psychosis. I mean, the list goes on and on. So cognitive behavioral is one practice that is not a medication that is very effective, okay? Now, cognitive behavioral is a very active therapy. So if you're kind of more of a timid person, it may not be the best for you, primarily because you have to do homework. Your therapist is very active. They're going to be pushing you for, what do you think about this? What do you think about this? And they're going to be really trying to assess your thought process and how and what your anxiety or depression are driven by. Mindfulness-based stress reduction is if you're a very anxious person. Mindfulness is being present in the moment, being able to accept what those emotions are, but do not let them impact your emotional state, your physical state, staying calm and present in the moment. And that, for many individuals, can reduce stress. Trauma-focused therapies, that is an umbrella in itself. We could literally go on for that for a whole other hour. So if you find that you're having many of the trauma-related distress symptoms, I would recommend that you talk to your doctor and then we can go a little bit more. Or if you are interested, then please email Kristen. With regards to pharmacotherapy, okay, or medications, antidepressants are probably the most common. And they typically fall into two categories: the selective serotonin reuptake inhibitors and the selective serotonin norepinephrine reuptake inhibitors. Big fancy terms. One that works on serotonin, one that works on serotonin and norepinephrine. Both of them are very effective for both anxiety and depression. Okay, so the medication classes are fairly simple. They do take time. Okay, that's one of the downfalls with antidepressant medications, is that the benefits take on the order of weeks. Okay, so the first few weeks, when you're probably dealing with your most intense symptoms, you may still not be having the benefits of the medication, which is why I am advocating for you to talk to your doctor sooner, so that if you are interested in trying medications, you can get them started sooner rather than later, so that we can start getting those benefits, which we know are typically on the order of 2, 4 to 6 weeks, depending on the dose for individuals. Anti-anxiety medications, which are typically used as needed. for in moments of anxiety, panic attack, sometimes to help you wind down at the end of the day so that you can fall asleep. And in fact, even some of the anti-anxiety medications, Ativan and lorazepam specifically, have actually been used to help with nausea. So we know that there is some anxiety that comes along with the intensity of some nausea. Sleep medications, this is a huge one because sleep is so important for energy the next day. And again, please be sure to discuss any new medication with your oncologist or primary care doctor. And depends on how you look at it, with COVID, telehealth options are much more available for supportive services, and they have increased access to mental health. For many, they still crave that one-to-one, that face-to-face, but there are face-to-face options, but telehealth will definitely get you seen a bit sooner. And that brings us to the end. Next slide, which is just next slide. There we go. Sorry, just some take-home points. It is normal and expected. Anxiety and depression are the most common. Talk to your doctor for guidance and referrals, and please be open to giving and accepting support. And know that there are effective treatments available. Okay, and with that, I see that we have some questions. Can you discuss the difference between depression and despair? That is a very difficult question, to be honest, because for many, those symptoms often kind of overlap. Now, typically despair is this sense of hopelessness, okay? And so I think about despair falling in as a symptom of depression, okay? Doesn't mean that you are depressed. It means that you're dealing with a symptom that can fall under that cluster. So in my mind, I am equating despair and kind of this sense of hopelessness, feeling as though things are not likely to get better, okay? And so that's how I think about those two. And you can have despair without having depression, okay? But it can also fall under that umbrella, okay? And then I already take several medications, and my doctor wants me to take an antidepressant, which I'm hesitant to try. Will it really make a difference? And then I'm actually going to throw in this next question. How do these types of medications interact with cancer medications? Okay, I'm actually going to take both of those questions together. So antidepressants, there are some that have drug-drug interactions, which is why I'm encouraging to make sure that you talk with your oncologist. However, there are and have been numerous studies, including Cochrane Medical Library Reviews, meta-analysis that have looked at this very issue, okay? And I can promise you that your oncologist will know there are two primary antidepressants that can be used safely with the majority of cancer treatments. However, okay, sometimes depending on other supportive medications, opioids, anti-nausea medications, okay, which in conjunction with an antidepressant can affect the EKG, okay, which is the electrical conductivity of your heart, okay. Now, doctors are fully aware of this. This is something that we monitor. It's called QTc prolongation, okay. If that is the case, then it would not be safe for you to take that medication, but that's something that can be monitored, okay? And that's something that can be checked for. So yes, the question is, it can be effective. Yes, there are safe options for you to take, in the majority of cancer survivors can take it safely, okay? And will it really make a difference? So this is a loaded question, okay? And will it really make a difference? What has been shown to make antidepressants effective is you have to take it every day, okay? You have to monitor to make sure that the dose is at the sweet spot for you, okay? I'm going to use Celexa as an example, or citalopram. 10 milligrams, 10 to 40 is the range. Maybe one person, all they need is 10. Maybe the person needs 40. That doesn't mean that the 10 milligram person is less sick than the 40 milligram person. It's what their brain needs to reduce the symptoms, okay? It's about imbalance. It's about correcting that balance. And so being mindful of that, okay, you have to be at the right dose, okay? So let's say you just start that first dose, 10 milligrams, and you're really a 40 milligram person. You won't know if that medication is truly effective until you get to that point, okay? So it is important that if you choose to to start a medication, that one, you have a doctor who's willing to kind of make sure that they go through all those steps, make sure that they've done their diligence to find your sweet spot, to actually give you a meaningful chance to experience the benefits. If you get to that point, yes, they can be very effective, life-changing for some people, okay? Will I get addicted to antidepressants? So I'm going to take that one. Antidepressants are not addictive in the sense of what addiction means. Your body will not crave them, okay? When I think of addiction, I think of someone who is craving. Their body goes through withdrawal symptoms when it doesn't have that in their system, but they're using it for a euphoria, right? What they're actually using for is for that euphoria, that sense of pleasure, that sense of taking them away from everything that's bad. That, in my mind, is the addiction. I am addicted to that euphoria. I am addicted to this pleasure. I'm addicted to this. I can forget everything else that's negative in my world. Okay. I think for many patients, they feel like addiction, meaning that if I stop this, I'm not ever going to be able to stop it. That is not true either. But with many medications, not just psychiatric medications, many of you, I would imagine, have been on steroids. You can't just take you from a high dose of steroids to nothing. You have to taper it. And because your body will always move to a place of homeostasis or normalcy, adjusting to what you're putting in it. And so the body has to taper. Antidepressants like that is no different. So no, they're not addicting. But yes, we have to use standard medication practices, which is to taper them to allow you to experience coming off of them with minimal adverse effects. And we are out of time, so I probably will call it at this point. I'm sorry if we didn't make it to your question, but I promise you I will make some time today to sit down and get those questions answered for all of you. I really appreciate this, and I appreciate Hogue for putting on this amazing symposium, but I will turn it over to Kristen now. Take care. Bye, everyone.
Thank you so much, Dr. Garcia, for that wonderful presentation. As Dr. Garcia mentioned, the oncology social work team is available to help guide you and assist with either counseling directly or referring you to outpatient options, in addition to speaking with your oncologist or your primary care doc. So just remember that they're a resource and always available to help with any type of guidance needed. So we're going to shift gears. As Dr. Garcia mentioned, managing your healthy lifestyle can definitely help with regards to improving mood and anxiety. So we're excited to introduce to you our two massage therapists. Today we have Elaine Louie and Nancy Cohen with us. Both of them are phenomenal oncology massage therapists that practice here at Hogue, both in Newport Beach and our Irvine location. And they are going to share some information about how you can integrate both massage and Reiki practice. If you're not familiar with Reiki, they'll give you a little heads up on what that is into your cancer care treatment. So welcome, Elaine and Nancy.
Thank you. Thank you very much. Hello. Welcome all. So excited to be here today to be able to talk to you about our passion. We are so pleased to be able to offer safe and effective oncology massage to our patients in the Hogue Cancer Center. Our program has been well received for the last 5 years, and we hope that after today you will have a clearer understanding of the benefits of Reiki while in treatment, in recovery, and survivorship. Now Elaine is going to lead us through a breathing exercise, and I am going to demonstrate.
So this is also called diaphragmatic breathing. It induces the relaxation response, which directly involves the lymphatic system. One of the primary functions of the lymphatic system is the immune system function. So what we're going to do is Nancy will demonstrate. We're going to put one hand above our belly and one hand below our belly button. And by doing this, we have now covered 2 acupressure points that promote calming and helps the GI discomfort and nausea. I'm going to explain what we're going to do, and then we will breathe together. So first, we're going to be breathing in through our nose, deep down into our belly, We're going to hold for 3 seconds, and then we're going to blow out all the air through our mouth, emptying the belly. So let's begin. Breathe in through your nose and deep down into the belly. Hold. 3, 2, 1. Blow out. Emptying that belly. Again, we're going to breathe in. Hold. 3, 2, 1. Breathe out. Last time, breathe in. Hold. 3, 2, 1. Breathe out. This is an exercise that you can do at any time when you may feel anxious or are in need of a little relaxation. Another great benefit is that it activates our lymphatic system. Next slide, please. We would like to share a short poem written by a cancer survivor. To educate is to give power. To give power is to gain control. To gain control is to reduce fear. To reduce fear is to give hope. And hope is life's key to survival.
In our day-to-day life, we have such a long to-do list. And when we actually make it onto our own to-do list, it's usually for the dentist, the mechanic, or a school meeting. It seems almost selfish to put pleasure, our pleasure, on that to-do list. But if by doing so we can create a positive pharmacological response in our own bodies and make our day-to-day experience of life a little better, then why not get a massage? Touch has been a touchy subject despite the fact that research so clearly supports the benefit thereof. As an advanced first world country, we are amongst the most deprived people in the world, or touch-deprived people in the world, I should say. Sometimes we don't touch because of possible misinterpretation. Sometimes it's because disconnection aided by technology. Sometimes people are not in a relationship. Healthy touch is not an option. Or sometimes people are in a relationship, but touch is not the norm. Also, COVID has greatly disconnected and isolated people from touch. It is not right or wrong. It is just the way it is. Touch provided during massage should be safe and skilled. It should be designed to work with your medical, physical, and emotional considerations. It should be provided respecting your guidelines and boundaries. With integrative care, massage has been accepted and widely used and is classified as a complementary medicine modality.
So what is oncology massage? It is a massage customized to your unique medical needs. We realize that symptoms and emotional and physical needs can change from day to day. So our goals and intentions for your session are to be present for you and your current related needs, such as a massage tailored to calming for anxiety or relieving pain, even just for a little while. Massage can also help with fatigue or encourage the lymphatic drainage for those with lymphedema or for those at risk for lymphedema. Now let's talk a little bit about Reiki. What is Reiki? Reiki therapy is based on Japanese healing art, where vital energy flows through the body. It is a form of energy healing and a type of alternative medicine. Reiki, as a holistic healing therapy, has been taught in the West since 1938, and in Japan since the early 1920s. Pronounced Reiki, the Japanese word is most often translated as universal life force energy. The idea is that a Reiki practitioner uses gentle touch or places their hands just above the body to help guide this energy in a way that promotes balance and healing to the person. Reiki is ideal for those who want to relax and feel better without actually being touched, or they can just enjoy gentle, stationary, therapeutic holds. Next slide, please. The next slide is a mantra often used in Reiki that we would like to share. Reiki restores physical and emotional well-being for your higher goodness and well-being. Just for today, do not worry. Just for today, do not anger. Just for today, be humble. Just for today, be honest. And just for today, be compassionate towards yourself and others.
So now that we have an explanation of oncology, massage, and Reiki, how does this apply to your session? Your session is tailored to your comfort level. For example, you will be positioned comfortably throughout the massage. If preferred, you may leave your clothes on. You may request to work on a specific area, such as your feet for neuropathy. You will benefit from a gentle therapeutic touch. We understand that at any time during your massage, you may have questions, you are not comfortable, or you don't feel well. Please do not hesitate to ask something. This is your session. If the therapist does not ask any intake questions, then it is the wrong therapist. Always ask for an oncology-trained therapist for your massage. A therapist's good intentions are always good, but may not be good enough, especially with people with a history of cancer.
Next slide, please. Here's a list of the benefits of massage, and there are many. Let's go over the list, and if you're interested, you may want to take out your phone and take a screenshot. So reported benefits of massage include increased relaxation, improved circulation, improved lymph flow, reduced headaches, reduced edema, eased joint stiffness, soothed sore muscles, eased mental fatigue, eased physical fatigue, relieved insomnia, decreased stress, eased constipation, decreased chronic pain, decreased nausea, opens energy pathways, rebalancing the mind and body.
Decreased nervous tension, warming of the muscle tissue, relief of cramps and spasms, calming of the body, reduced inflammation, lowering of blood pressure, improved immune function, decreased neuropathy symptoms, improved range of motion and flexibility, eased isolation, increased energy, enhanced body image, and the most important, it makes you feel good. Research demonstrates that nurturing touch is a basic human need for maintaining health, indeed for life itself. In our high-tech, low-tech society, it is no surprise that massage has been embraced as a safe structure for receiving and giving. The human touch that is intuitively known nourishes the spirit along with the body. Massage is used by many people for many different reasons. All professional sports teams have massage therapists on staff, and athletes use massage to decrease pain and recover from injury. The military uses massage for those same reasons, as well as a treatment for PTSD. Caregivers, mothers, teachers, nurses, and countless others also use massage. They do it because they say it feels good and helps them feel better. So this is easy. Come do something good for yourself. Let us take care of you. Our skin is our body's largest organ and is innervated with nerves. When those receptors detect the experience of a positive touch encounter, the nervous system sends those messages to the brain, and there are many processes that begin to take place inside of the body at the cellular level. Touch has been shown to decrease levels of cortisol, which is the stress hormone. Modifications. In the world of traditional massage therapy, of all your clinical considerations, should be considered as contraindications for massage. With appropriate therapist training, though, these clinical considerations need not be considered as contraindicated, but do need to be modified. Understanding the need for that is self-evident for all and is easy enough to address with the appropriate know-how. The real dilemma is that some modifications, such as, but not limited to, lymphedema or risk of lymphedema, may require long-term or lifetime considerations. And as patients move further away from their healthcare crisis and medical treatment and become stronger and feel better and get back to normal or the new normal, they may undervalue the importance of modifications required for a future massage and also the necessity of sharing their medical history with their therapist.
You will hear us talk about and ask questions regarding lymph nodes, lymphedema, the lymphatic system, and lymphatic drainage. How does this apply to you and your massage? Your lymph is a colorless, protein-rich fluid that circulates throughout the lymphatic system. The main role of the lymphatic system is to act as a filter against microbes, organic wastes, and other debris. Who is at risk? Anyone who has had lymph nodes compromised by the way of biopsy, radiation, or surgery is at risk, and that is forever. Sometimes it can be triggered during treatment or even decades after treatment. With proper care and simple modifications, the lymphedema risk can be kept at a minimum. Lymphedema is uncomfortable. It is time-consuming and costly, and in most cases, not reversible. This is why you will benefit from seeing a trained oncology massage therapist. The information that you provide as a client will help the oncology massage therapist make proper modifications to ensure that your risk for lymphedema is kept at a minimum. Next slide, please.
Now, we would like to invite any questions that you may have.
Hi there. We have had a couple of questions come through the chat. Can you guys hear me?
Yes.
Sorry, I'm getting a little bit of an echo on my side. Okay. What are the benefits of oncology massage?
Do you want to take it?
Sure, I'll take that one. Our target benefits are to reduce pain and physical discomfort, nausea, constipation, anxiety, fatigue, and neuropathy.
Okay, and looks like we have another question here. What's the difference between regular massage and oncology massage?
I'll take that one. The experience will be similar to a regular massage. However, as an oncology massage therapist, we modify the treatment to be a safe, gentle, and nurturing massage tailored to your unique medical needs.
Why is the massage modified from what we would normally get in a massage appointment?
It has to do with being in active treatment or even long-term survivorship. Some examples of that would be if you're in active treatment, we have to take into consideration compromised blood cell counts, fatigue, blood clots, tumors, surgical sites, medical devices, skin, hair, nail, and GI side effects, vital organ involvement, bone pain, bone mets, neuropathy, lymphedema, and fragile skin care, or skin tissue, I should say. And then in long-term survivorship, the modifications that we have to be aware of are vital organ and bone involvement, neuropathy, fatigue, scar tissue, lymphedema, and risks thereof.
So how do you make sure that a massage will be safe for each individual patient?
Yes, I can take that one. So with the initial session, we will have you fill out an intake form, which we will use to discuss your specific needs and to make sure we understand your goals, your intentions, focus, and personal preferences. Above all, we will always be taking measures to make sure the massage is safe for you.
Okay, I have another question here. So for those who are used to deep tissue massages, how can you benefit from a gentle, nurturing massage?
Yes, deep tissue, we get a lot of requests for that. And with people that are in cancer treatment or even survivorship, we just found that gentle massage is the most effective to stimulate the lymphatic system and thereby calming the nervous system and relaxing your body, which makes it conducive to healing. Sometimes with deep tissue, again, we have to take into consideration bone mets and surgical sites, and we may do more harm than good. And deep tissue, sometimes it makes you feel like you were hit by a Mack truck a couple of days later, and that's not what we want you to leave with. Yeah. We want you to have increased energy and to have that deep tissue. It just is, it's not counterintuitive to a relaxing massage.
Yeah, and actually deep tissue is kind of in a sense traumatic to the body because your body is being taxed already by the treatments and recovery and the medications that are going through your body. So we don't want to tax your body any more than it needs to, so that it can just focus on healing rather than fighting the inflammation that can be caused by deep tissue.
Right.
So deep tissue is definitely not recommended for people that are in active treatment.
What other kind of customizations can be used during an oncology massage session?
Do you want me to take that?
Yeah, you take it.
Okay, so there are many modalities that can complement massage. As needed, we may incorporate modalities such as manual lymph drainage, education of the lymphatic system so that you can understand how this all works, and acupressure points, reflexology, breathing exercises, relaxation techniques such as guided imagery, And Reiki is another modality that can be combined with massage or a treatment on its own.
Excellent. It looks like those are all the questions that we have in the chat. It sounds like it's really just adjusting kind of your definition of what a massage might be, from that painful deep tissue to actual gentle relaxation and nurturing so that you can allow your body to heal, which sounds lovely.
Yes. Yeah, definitely, definitely. One of the other questions that I get a lot is that people have just finished with their surgery and they can't even imagine what it would be like to get a massage, because they can't lay on their stomach because their breasts have scars, or their lymph node area hurts, or just something like that. So we accommodate the surgical sites without added pressure, padding, extra padding, positioning such as side lying, working around the area or the avoidance of the area altogether. And again, this is another option for a Reiki session.
Yeah, and quite often people come in with a lot of pain and discomfort, and they can't even imagine how they can get comfortable on the table. And most of the time, people leave, just completely surprised at how good they feel.
Right. It's just really important that they know that we will take care of them and that we will make sure that they are comfortable and safe and leave more relaxed than when they came in.
Is there a certain amount of time that people should wait after a surgical intervention or even after radiation or chemotherapy before scheduling a massage?
Actually, the straight answer is no, because we make modifications where it will be safe no matter what situation or stage of healing people are in. I usually tell people if they feel up to going out and coming in for a massage, then we can work with that. Any time is a good time as long as they feel up to coming in for a massage.
And then do they need to have any type of physician clearance in order to come in to get a massage? Is that something that...
Yes, after surgery, after certain treatments, the doctor will give them a go-ahead to come in. And then I believe...
We do have a physician liability form that needs to be signed by the physician before coming in to see us.
Yes.
Okay.
And then as far as radiation and
Surgery?
No, not surgery, chemotherapy. We don't have to wait 48 hours. No, we don't have to wait 48 hours. And chemotherapy, it's how you feel after your treatment. And sometimes you're feeling awful, and it's best to push yourself and come in, and we can help you feel a little bit better.
That segues nicely into a question that just came in. Will I feel the benefits immediately?
Generally, yes.
Yes.
Quite often, I know I've been told, but I'm sure both of us have been told that the second we put our hands on their bodies, they start feeling a difference.
And I think numerous times, in fact, last Friday at work, it happened. The client comes in very agitated, very, a lot of anxiety, whatever stage they're in, just a lot of anxiety. And immediately we put our hands on them and we start massaging and we go through breathing techniques and they calm down and they leave, and the first thing they say is, I feel better. I feel better. I feel calmer.
And even if they don't tell us, a lot of times we can tell by their demeanor, They may come in just, in a lot of agony, and they might be leaving with a smile. We can also tell with the circulation where the color in their faces might be a little bit more pink and rosy when they leave.
Yes.
And just, a
Yes.
brightness in their eyes when they leave. Those are some of the things where we can tell that the massage made a difference for them.
Yes.
And then I've got one more question. I'm curious about Reiki, life force energy. What is it?
You want to take that?
It's the $1 million question.
Yeah, $1 million question. The word taps in Rei and Ki meaning the energy, and Rei, you have the life force, and it's a unique experience to where you can just let go and just let the energy flow through you for a healing process. And you get extreme relaxation with it. I hope that's a good explanation of it.
As a practitioner, I like to explain it as our intentions. So with every movement and every part of the therapy, we are projecting intentions through our hands, whether it's touch-based like massage or therapeutic holds or just hovering above the body. We are projecting our intentions as to a certain part of body, what we'd like it to do, such as the calming, the relaxing, and healing. It's, that's the way I would explain it. As a therapist. That's how I envision it when I'm providing the Reiki therapy.
Yes.
I hope that helps.
Yes.
So it sounds like because there's no touch, that's something that would definitely be okay post-surgery.
Yes.
Are
Absolutely.
there benefits to getting Reiki or massage before treatment or surgery?
Yes.
Absolutely.
Absolutely, because you do have a lot of anxiety going into the treatment or the surgery, and it helps to calm your nervous system.
And once the nervous system has been calmed, it makes your body more conducive to the treatment as well as the healing. So even massage and Reiki also go hand in hand with physical therapy because they both help each other. So we can help soften and relax muscles and nerves before the PT treatment so that it can be more effective.
Right.
If that makes sense.
Right, right.
Yeah.
And when I know that a client is going in for surgery or has just an abundance of anxiety, I always start with breathing techniques and explain to them they can do it anywhere at any time. And just by activating those acupressure points, you can just lower your shoulders, calm your body, and let your body heal and do what it has to do to get to the next step.
The next question that's come in is there a cost for these services?
Yes. We try to keep it as cost effective as possible
For our patients.
for our patients. A Reiki session is $35, and the massage itself is $45. Yeah,
For a 45-minute session.
45-minute session, yes.
Excellent. It looks like that's it from the question feed. Did you want to take a moment to go over your resources, or should we share those with the attendees?
Yes, if we can put the resources back up. The first two websites gives you multiple information on oncology massage, but also can help you find massage therapists that are trained in oncology massage. And if we can have the next slide come up.
So sorry, 1 second. Going back to Society for Oncology Massage, the participating providers will be listed in there. And so you can either put in your area of preference or your zip code, and it'll pull up all the practicing oncology massage providers. And then it'll be your choice to choose one and contact them, and you can ask them about your needs and see if they are the best person for you, because everybody might have different types of training, but it is mainly for oncology massage therapists.
Mm-hmm. But we want you to come and see us. Our next slide, please. There's our phone number. Please give us a call. It's for both the Newport and Irvine locations to make appointments. We're just, in closing, we want to thank you so much for your time you've given us, and for us to share about our passion about oncology massage and Reiki. And we hope that if you haven't tried these treatments, that you will make the time to allow us to take care of you. Mm-hmm. Do you have anything else?
No, it would be our pleasure to be able to provide you with a relaxing, pleasant, mm-hmm. feel-good session. Mm-hmm. And if you haven't tried it before, if you've never been touched or had a massage, we'd be honored.
Yes.
For you to come.
It's a wonderful experience.
Give you your first experience.
Yes.
Thank you so much, Eileen and Nancy. I deeply appreciate you sharing all that great information with our patients and helping to remind all of us to take a moment to care for ourselves. Yes. And just a reminder for all the attendees, the presentations are available for download in the YouTube description. So you'll be able to find all of these slides there and get all of that information there. So we are going to shift over to our next presenter. Lauren Messelbeck is a board-certified acupuncturist and the founder of LifePoint Acupuncture in Newport Beach. And she is focused on providing supportive acupuncture care for oncology patients through treatment and into survivorship. We're so excited to have her with us today to talk about the role of acupuncture in oncology supportive care. Welcome, Lauren.
Okay, I've been unmuted, correct?
Yes.
Yes, okay, great. Okay, so thanks for having me here to talk about my passion, which is acupuncture. I mostly enjoy supporting patients through their treatment and into survivorship, and have an incredible team has had similar training to me in order to make this dream a reality for so many patients in the area. A little bit more about myself is my journey in healthcare really started when my brother was diagnosed with acute lymphoblastic leukemia. When I was about 15, he was 11, and he received great care at CHOC, but I really walked through that whole process of treatment and saw firsthand all the side effects of treatment and the challenges they present. And that was a true catalyst for me to continue my journey in patient care. I went ahead to study physical therapy because I was an athlete and a dancer, and I was very interested on figuring out ways to function and perform at the highest possible potential for my body. And then got introduced to acupuncture when my aunt, who was a patient here at Hoag, actually was going through treatment for ovarian cancer. And she wasn't able to continue her treatments because her counts kept dropping. She was getting too nauseous. She was getting very dehydrated. She started to do acupuncture, and it made all the difference for her. So I decided I had to learn more. I got my master's in traditional Chinese medicine, and things really came full circle. I got my first job out of school working for the head of integrative medicine at CHOC, and got to work with some of the doctors that my brother was treated by. and really begin to learn so that's enough about me. Let's go ahead and go through the presentation. So next slide. I'm talking to you today about acupuncture and supportive care for oncology patients. Next slide, please. So what is supportive care? It's care given to improve quality of life to patients who have a serious or life-threatening disease. And this has been defined by the National Cancer Institute. So our job is to prevent or treat as early as possible, and I want to emphasize as early as possible, the symptoms of the disease, but also the side effects caused by your treatment, the psychological and spiritual problems that come with that disease and diagnosis prognosis. Next slide. So once again, our goal is to improve quality of life while the patient endures both physical and emotional trauma. Trauma is being discussed much more today, as so many of us have gone through great trauma since the pandemic in 2020 and figuring out how to process it, both in our body and how it affects our mind. So surgery, of course, is an extreme trauma, and it doesn't end at surgery. There's scar tissue, there's lymphedema that can happen after the surgery, and of course, chronic pain. Chemotherapy, of course, produces a lot of side effects, such as nausea, which we're excellent at treating, and neuropathy, which I treat and try to treat as soon as possible in patients that are going through treatment. Radiation side effects, such as pain, diagnosis and prognosis, whether prognosis is good or bad, honestly. Many of my patients, once they receive the news that they are cancer-free, begin to experience some anxiety about what's to come. Their counts are also recovering, so their energy is improving, but there's also that, what comes next? What if the cancer comes back? How am I going to do this again? And then also keeping other patients' spirits up as their prognosis might not be so great, and keeping them strong in their fight. Chronic pain is something that occurs after treatment. And of course, the pharmacological side effects, that does not stop after treatment. For women with hormone-positive breast cancer, for example, you're put on hormone suppressive drugs, which cause side effects such as hot flashes, disruption in sleep, and even muscle pain. So we are excellent actually at balancing hormones because of our effect on the nervous system, and treat menopausal type symptoms quite frequently. Next slide. So what is an acupuncturist? We are licensed. Here in California, you have to be licensed by the California Acupuncture Board, which is a separate test that you have to take. You have to complete your master's in traditional Chinese medicine. This is about 4 years, all said and done, which is very extensive, but you're really learning a whole new set of diagnosis within traditional Chinese medicine and specific modalities that most of us aren't familiar with here in the United States. So it's very important to develop that confidence in your theory and diagnosis, and then learn how to implement it within our system and translate it. I did about 3,500 hours to your internship where you do at this school, but we also had externships at my school with UCSD. I worked within the cancer center, and I worked on the athletes and at Rady Children's Hospital. There's also a national certificate if you're outside of California, that covers several states within the United States, but not California. Next slide. So now let's talk about how much we're seeing the benefits of acupuncture. The U.S. Army has added acupuncture to its list of effective treatment methods to help care for its wounded veterans. The VA is responsible for a lot of the research that has happened with acupuncture. Battlefield acupuncture was also developed to streamline treatment and quickly reduce pain when they don't have access to regular care. Next slide, please. Professional athletes, of course, are starting to use acupuncture. Many of the teams have their own acupuncturists. I actually worked at Pro Sport here in Newport Beach every summer doing my PT hours, and the man that was the PT assistant there at the time became a PT, and then he did acupuncture school, and he now is the acupuncturist for the Chargers here and works on them here where they practice in Costa Mesa. Next slide, please. About 38% of US adults and 12% of children are using some form of integrative medicine. And I believe this has grown even more as time has passed. Cancer centers, hospitals, pain management centers, and wellness clinics are beginning to expand their services to include acupuncture. And actually, a lot of other practitioners are starting to use modalities within the acupuncture scope of practice. So a lot of PTs, a lot of athletic trainers are doing cupping. They're doing something, they call it grafting, which comes from something in Chinese medicine called guasha, where you scrape along the muscles to alleviate adhesions in the muscles or knots in the muscles. It's like a very fast form of massage, and it feels amazing. And actually, some medical doctors are beginning to practice acupuncture. Next slide. Research into acupuncture as a medical treatment has grown exponentially in the past 20 years. And as I said before, the US Department of Veteran Affairs did a systematic review in 2014, and that found acupuncture to be effective in treating 117 conditions. Next slide. So 117 conditions seems like a lot. I've highlighted some in the red on the left that are more relevant to what we're talking about today, such as pain of any kind, cancer-related fatigue, chemotherapy-induced nausea, post-operative pain, post-operative nausea and vomiting, anxiety, depression, insomnia, and let's go to the next slide. There's a few more, actually. So this is a really nice image that summarizes some of the things we're most famous for treating. Nausea is probably one of the things, nausea and pain are the things that have been the most studied for us to be the most effective in treating. And anything with an itis at the end, so anything with the basis in inflammation in the body. And of course, the stress response. We are incredible at reducing the stress response in the body, which can help control all sorts of things such as GI issues, high blood pressure, even pain, and insomnia, of course. Next slide. This is for you guys to look at. This is the website where I pulled some of this information that has some of the controlled clinical trials on effects of acupuncture. Next slide. So let's talk about some of these things that we commonly treat. I'm going to show you guys some points that we commonly use and then can eventually teach patients as a form of like self-care so they can press on these points to alleviate some symptoms. So cancer-related, next slide. Fatigue. This is probably something that every cancer patient experiences and actually can continue to experience after processing all this trauma, both physical and emotional, that comes with treatment. Next slide. Brain fog and chemo brain. That kind of comes with the fatigue aspect, but is a very real thing. Many patients complain of this, and the next slide shows you one of the acupuncture points we use very commonly for the brain fog. You can go to the next slide. So D20, we find this one at the apex of the head, and it's incredible at actually even improving energy levels and concentration. Next slide, please. Neuropathy. So this is one thing that I wish that I could catch more than anything when patients are in treatment. They're going through their chemotherapy, as some of those chemotherapies are very famous for causing neuropathy. And it's something you'll know because they'll be asking you about it every time you go in for a treatment, because we really don't want that to progress because it starts to affect your ability to get dressed, your strength in your hands, your ability to drive your car, or even walk. So we really want to catch that before it progresses, and sometimes they'll even pause your treatment if it goes too far. Next slide will show some of the points in the feet that you might experience with your acupuncture treatment for neuropathy. And obviously there's several points in the hands as well. Next slide, please. Anxiety and depression, which I talked about before. There's a lot of this that goes with facing a life-threatening disease, and very common for us to treat hand in hand with other healthcare professionals, of course, to help, give patients tools outside of the office as well to help prevent one swing of anxiety and depression from going too far on their own at home, and then obviously acknowledging it at their treatments. Next slide. This is one of the most famous acupuncture points. It calms the mind, improves sleep, and it also reduces congestion because of where it is locally. This is the point actually people come in requesting because they love it so much. Next slide. Insomnia is a result of all of this, stress on your body. It can also be a side effect of pharmacological treatment, such as steroids, which you commonly use during your treatment. And then also the hormone inhibitors can cause insomnia. Next slide. This one shows some of the points you might expect to see when you come in for your acupuncture treatment. You don't have to see them. A lot of patients choose to close their eyes and just relax while I'm quickly needling them because they don't want to see it. Not because it's painful, just the sight of a needle for some people will make them very nervous. But I'll explain why there's no reason to be scared of them in a little bit. Next slide. Headaches is also something we're very famous at treating. The next slide will show you a common point that we use. It's located on the dorsum of the hand here. On the second metacarpal bone, you come just off of it, right in between the edge of the bone, right in the middle here. So someone might have told you in the past to press between your thumb and your pointer finger to alleviate a headache. That's our acupuncture point called large intestine 4. It's the command point of the head and the face, and this is a great tool to provide patients. A lot of patients suffer headaches due to the stress that they hold in their neck and shoulders, but also from dehydration that occurs from excessive vomiting and nausea with treatment. Next slide, please. So this shows an image of LI4, which is it's halfway between your second metacarpal bone right here and just off of it. Okay, next slide. Nausea. So as I said, this is something that we're most famous for treating. We can actually provide patients with a small tack that has like a Band-Aid with a very teeny tiny needle on it that will fall right at this point, P6. So how you find this point is you're gonna extend your arm out like this, and you're gonna place your index, middle, and pointer finger at your wrist crease. And right at the edge of where your pointer finger or your ring finger, depending which side you're on, falls is Pericardium Sticks. This point is actually, if you've ever seen C-bands for motion sickness, I think they actually call them acupressure bands now. That's supposed to push on that point. Many women use it for morning sickness. We treat many women for morning sickness in the beginning or throughout their whole pregnancy. And we can give them this tack as kind of a marker for where to push and also where to place those bands to control their nausea. Next slide, please. Diarrhea and constipation are extremely common. Any kind of GI issues are commonly seen with treatment, and any stressful experience, especially one in which you could be possibly receiving a surgery that affects the process of your digestion. A lot of my ovarian cancer patients have this issue, and we're able to help them a lot with regulating their digestion, which actually improves their nausea as well. The next slide will show you one of the most common points we use, stomach 36, which is just off your tibia. So if you go to the next slide, then it's about 4 finger breadths down from your patella, which is your circular knee bone right there. And it's just 1 finger breadth off of your tibia towards the lateral side. Okay, hold on, I have a couple of questions. So it says, are there any types of cancers where acupuncture should be avoided, or is it beneficial for everyone? That's a great question. I've never experienced a cancer that has not had benefit from acupuncture. So in general, most cancers receive somewhat similar treatments, or even the cancer themselves can cause pain or neuropathy or many of the things that we treat. So I highly recommend it for anyone going through cancer treatment, and just also some of the psychological things that I've mentioned, like disruptions in sleep. It says, what about boosting immunity and general wellness? Yes, actually this point right here, stomach 36, is one of the most common points to boost the immune system. We also have a modality called moxibustion, where we apply an herb to this point that helps improve counts and boost your immunity. Also, the acupuncture itself reduces the stress response on your body, which will then itself boost your immune system, because chronic stress over time will cause your immune system to be suppressed. Okay. Please go over the points on your hand again between the thumb and index finger. So between the thumb and index finger, I don't know if you guys can see me right now, but so right here is Li4. So it's halfway between the second metacarpal bone, and then you're going to come just off the bone towards the thumb here, and that's Li4, one of the strongest points for treating a headache. Okay, next slide, please. Oral mucositis or mouth ulcers are commonly seen. Many of the chemotherapies will affect the soft tissues, and acupuncture is actually excellent at treating mouth ulcers. Next slide. Lymphedema is something we commonly see. We're able to combat that with our effects on the circulatory system, and also with some of our massage techniques and gua sha. Next slide, please. Low resistance to infection. So this we kind of just covered with my talk about boosting overall immunity and general wellness. Our ability to reduce the stress response and actually boost patients' counts while they go through treatment will help them combat secondary infections. So I remember one of the worst things that would happen is if my brother got sick, he had to go in hospital because he's pediatric oncology, and they would have to go watch him for 2 weeks. And it was just awful. It affected the whole family dynamic with the absence of our parents and whatnot. So being able to avoid any infections around you, especially now, is very important. Next slide, please. So this kind of goes hand in hand with what I just said. We are able to help boost the white count and low red and platelet counts by boosting the immune system, essentially. Next slide, please. And pain. This is probably the thing that most people come in for in general. It varies between neck and back pain probably being the thing that we see the most as acupuncturists. Next slide, please. So how does it all work? So acupuncture can induce multiple biological responses in the body. So one of the most common things people think of is it affects circulation, and most doctors are very aware of this now as well. We're able to relax. We increase blood flow in a very specific area where we're needling, which allows the muscles to relax and speed healing time. And then we also have a ability to affect the biochemical response. So we can increase certain neurotransmitters, which allow the body to relax, but it also affects your pain response. These responses can occur at the actual site of the application where we're placing the needle, or it can be affecting something in a distance from where we're placing that needle. For example, what I talked about with LI4 affecting the head. So point in the hand could be used for a headache. These and then these responses are mediated by sensory neurons, okay? Within your skin. This can lead to activation of pathways both in the brain and as well as the periphery, okay? Next slide, please. I love this image. It kind of helps summarize how we're able to affect so many different systems within the body. But what you really need to know is acupuncture needling promotes homeostasis and self-healing. In short, acupuncture stimulates the body to heal itself, okay? It influences your nervous system, the muscles, nerves, internal organs. It influences your cardiovascular system, the blood flow and distribution of nutrients and even hormones. It affects your endocrine system, like your hypothalamic pituitary adrenal axis regulation. This is a major pathway for homeostatic regulation, so balancing hormone response, okay? And just hormones themselves. And your immune system, it strengthens your immune system and function of the body. Most acupuncture points you're going to find are in areas where there's a high abundance of nerves and blood vessels and neuromuscular attachments. Essentially, neuromuscular attachments are where those blood vessels and nerves penetrate the muscle fascia and allow it to relax. Next slide, please. So evidence suggests that acupuncture decreases sympathetic nervous system. This is your fight or flight stress response, which is good. We need that when we're running for our life, okay? But it's bad over time, okay? And it will cause a constant flow of cortisol and start to affect the body in many different ways, such as increasing blood pressure, inability to sleep, even a decrease in blood flow to your muscles, and even reproductive organs. And it increases parasympathetic nervous system activity. This is your rest and digest. This is a good spot. Acupuncture stimulates the release of endogenous opioid peptides, such as endorphins. You get a huge endorphin release, very similar to if you've ever done a long run, that great feeling right after. These opioid peptides also act as hormones delivered to a variety of target tissues, which can explain why we can treat so many different symptoms. Acupuncture stimulates the release of non-opioid substances, such as serotonin, dopamine, and GABA. These are neurotransmitters that they affect inflammation and pain in the body, but also these neurotransmitters can help the body. They also promote restful sleep, they balance your mood, and they improve your concentration. Next slide, please. So this is one of my acupuncturists just doing a muscle test, more specific to our local effect on muscle. There is a 71% correlation with muscle motor points, which have been mapped out on the body. These are the points in which you really commonly find that knot, the bundling of muscle fibers, the chronic shortening of muscles that can lead to pain and injury over time. Next slide, please. So acupuncture and pain, let's talk about it. Next slide. I just have some of the studies for you guys to look at. I won't go through all of them, but I wanted to provide a good amount of them for you to look at because I know you can take these with you. This is one of the biggest ones we have on acupuncture, published in JAMA by the Institute of Medicine and National Academies. And it's talking about chronic pain and how it affects more Americans than diabetes, heart disease, stroke, and cancer combined. The study compared acupuncture to sham acupuncture in 17,922 patients, which is a great population pool. Sham acupuncture is basically fake acupuncture. It's needling points that are not part of traditional Chinese medicine. So they're not one of the channels in the body mapped out very specific that we are needling. This study found acupuncture is an effective treatment for chronic pain and is therefore a reasonable referral option. Next slide, please. And this is just provides like the numbers and comparing how many Americans suffer from chronic pain compared to the other primary conditions that we see in our country. Next slide, please. I love this study actually in regards to addressing the chronic pain that some patients have from their surgery and treating cancer and removing cancer. This was also published in JAMA. It followed 3,253 women. 2 years after their treatment, 47% reported pain in one or more areas. 52% of those reported pain defined as pain severe or moderate. And among those women, 77% had pain every day. 58% reported sensory disturbances like neuropathy, numbness, tingling, pins and needles feeling. Next slide, please. This is it basically summarized by the National Cancer Institute. They summarized the 7 cancer-related pain studies, and all acupuncture groups had a significant decrease in pain. In long-term treatment, there was equal to or better analgesia than conventional drugs. Next slide, please. This is a great study about headaches. It was a systematic review from the American Migraine Foundation, and it basically just showed that we're able to reduce the frequency of headaches in individuals, and that actually that reduction in frequency and duration of headaches was long lasting. So they began to have this effect. They showed this effect last for over 6 months. Next slide, please. Insomnia. As I said before, we're great at treating insomnia. Studies have demonstrated that acupuncture treatment appeared to be better than conventional pharmacological drugs in the improvement of insomnia. Total sleep duration actually increased by 3 hours. I'm also of the mind of better together approach. So acupuncture plus medication showed even better effect than medications alone on sleep duration. Next slide. Cancer-related fatigue. This is a great one that was published in the Journal of Clinical Oncology. It just basically showed that acupuncture improved fatigue aspects measured by the multi-dimensional fatigue inventory. This includes both physical and mental fatigue, that brain fog we were talking about, but also includes overall anxiety and depression, as those things can definitely take from your energy and quality of life. And one other thing I'll say is reducing pain for patients also helps boost their energy levels. Next slide, please. Other advantages of acupuncture treatment. We've already covered a lot of this, are improving sleep, so your body can rest, reducing overall stress on your body, allows your muscles to relax, boost your immune system, treat medication side effects, also increasing your overall body awareness in order to prevent things from progressing and getting worse. and treating them sooner rather than later. It speeds the body's recovery. There's reinforcement is a big one. I am able to really sit down with patients a little bit longer than most of other medical professionals and talk them through their treatment plan and expectations of treatment. And also empowerment is a big thing I like to push, giving the patients these tools such as the acupressure points and other different things that they can try, meditation techniques, breathing techniques, to help them manage their symptoms outside of the office. Next slide, please. So results in safety. I love this image because it shows how many needles we can fit into a hypodermic needle, which you're used to, which is about 16 of our needles. The positive change can be felt by the end of your first session. I would say most people just walk out so much more relaxed in general, and supported, and they can experience a change in their sleep pattern by that night, an improvement in their sleep. And digestion is something I see right away as well, digestion regulation. A treatment plan consisting of 8 to 12 treatments is more typical. And then 1 to 2 times a week, we'll usually see you in the acute state, definitely once a week. And then taper to bi-monthly, so twice a week, as you're starting to see the end of your treatment and have less side effects, basically, and starting to feel better. And then some people like to come check in once a month because they just enjoy it so much and they notice the changes it's having in their overall wellness. We use clean needle technique and OSHA standards. Every needle is individually packed, nothing's reused. Mild sensation around the needle is common, but it subsides as you begin to relax on the table. Next slide, please. Expectations of treatment. Usually you're there about 45 minutes to 1 hour. You're there longer than an hour your first time, as we get an initial consult which includes like a very in-depth history of both your chief complaint, but also your past medical history. We also like to get a list of your medications and your overall treatment plan if you're currently in treatment for cancer. And we like to discuss your expectations of the treatment and propose a treatment plan specific to you, and some goals that we might have very specific to treatment. And then reevaluation and tapering of your treatment is discussed later on. Next slide, please. Some common techniques we use, and it's not just acupuncture. So it's all within the umbrella of traditional Chinese medicine. So we also implement acupressure and massage. I know you guys just heard from the massage therapist. I have a massage therapist in my office. I highly recommend it. Having that hands-on treatment is super important, and we try to implement part of that into our treatment as well. But I do recommend having a longer session of massage outside of your acupuncture. Cupping is a negative pressure technique that we use, which I'll explain a little bit more of. What I talked about was the scraping and alleviating muscle adhesions, but also we gently will do it to provide a sort of lymphatic massage in instances of lymphedema. E-Stim is where we use like a stim machine, but we can actually connect them to the needles to treat very specifically some muscles that have possibly atrophied, or maybe there's a nerve impingement that we need to release. I've also started to use some LED light therapy, but that's more for our post-operative healing specifically. So let's take a look at what some of these look like. I have some images here for you guys. So next slide, please. Acupuncture. So as I said before, it should be quick and painless. This is what we do all day. So we should be very quick with it, and we try to talk you to you throughout the process. So patients don't get too nervous about it and you get used to it very quickly. Next slide. Acupressure is also implemented in your treatment, especially I like to get into people's feet and hands when they're coming in for neuropathy and of course for pain. Next slide. Cupping. So this is the image from my office of me doing slide cupping. It can look a little crazy, but it feels incredible. Basically, essentially pulls up on the muscles versus pushing down like you have in a massage. And then we slide them along the muscles, specifically like from origin to insertion. And we focus in areas of pain to bring fresh blood flow to the area to allow muscle and injury to heal itself. Next slide. So this is a video of me performing the slide cupping. I'm not sure. Oh, here we go. They're just going to play this for you really quick. It's kind of helpful to see what this looks like in real life. Hard to imagine. That's just magically sliding along the back. And this is a patient coming in for low back pain and neck and shoulder pain. Next slide. Gua sha, which I brought up before, this is the image of me using that tool on the jaw for a patient with TMJ. A lot of my head and neck cancer patients have issues with chronic jaw pain, and we also have to work on their anterior neck muscles quite a bit and their shoulder, which becomes affected by that chronic shortening and the neck muscles that have been affected by where they had to go in for surgery and also radiation. Next slide, please. This is an image of the E-Stim. So those are the little clips that attach to the acupuncture needles. Heat therapy is also implemented. So after we get your needles in, we put these TDP lamps over the body that heat up a mineral plate that allow your muscles to relax and just really make it so easy for a patient to relax. And our tables are actually heated as well in my office. Next slide. Massage, as I said before, is something that I try to incorporate into each treatment when it's relevant. Next slide. LED light therapy. So this is pretty new, and the idea came of using light therapy for therapeutic benefits from NASA, actually, who initially developed testing for astronauts who became injured or sick during longer missions, and they discovered that light energy had the ability to promote wound healing and tissue growth, which I use this specifically to treat inflammation and post-procedure recovery for patients. And I see a huge change in the overall scar tissue that's produced. Next slide. Nutrition is also something we talk about. Next slide will show you something that I promote in my office. It's just an anti-inflammatory diet, low glycemic index diet. We want to reduce the amount of protein while you're in treatment, and then we can increase after that. And of course, leafy greens all the way. Next slide. Okay, let's see. Oh, and that's what I just stated. So let's go to the next slide. I think we have some questions coming in. So education and empowerment is something that I already talked about. So let's go ahead and go to the next slide. Here, perfect. We have the next question that came in. Does insurance cover acupuncture? Here it is. So my office specifically, we are in network with most of the Blue Shield of California plans. It depends on your plan now, and Cigna, but we do bill out of network for patients, and we can provide super bills for you to submit to your insurance for coverage. Every plan is very different. my staff will provide an insurance verification for you before you come in, so you know if you do have coverage. And usually you'll have a copay similar to what you're used to when you go see your doctor. Medicare does not currently cover acupuncture. And even if you have a supplemental, a lot of the time I see them follow Medicare guidelines when it comes to acupuncture coverage. And then also some of the plans are very specific to the diagnosis. So they'll only cover acupuncture for very specific things. I recommend you going on your insurance portal to see if acupuncture is included and to look up the providers that are within your network and call their offices to see if they'll take your insurance and verify it for you. When is the best time to come in for acupuncture in accordance with my treatment cycle? This is great. So every treatment cycle is different, but generally I like to see patients even sometimes before they start their treatment. So I have a great idea of what chemotherapy they're going to be receiving, what their treatment plan looks like, and how we should line up their treatment in accordance to their treatment cycle. So usually you'll have a group of treatments within a round, right, of chemotherapy. So I like to see people 1 to 2 days after their chemotherapy generally, because you're given a steroid, usually with your chemo, and that helps mitigate side effects, but that starts to wear off around that 1 to 2 day marker. So then we can get on top of treating the nausea. And also neuropathy is super important. We got to see you every week so we can keep that from even happening or progressing if it has already started. And then hopefully get it to slowly heal itself over time. And even if you're having like a high dose treatment that is like you have a 3-week break, I still prefer to see you once a week so we continue to boost your immune system and your counts and tackle any side effects that you might be having from treatment, just so we can prevent them before they become worse. A lot of people want to know, let's see, what does acupuncture feel like? So the main fear is that it's going to hurt. I promise you that should not be what it feels like. And if you experience that, you don't need to. Acupuncture, that we insert the needle very quickly. It is a very small gauge needle. And if there is a sensation, some people feel it actually like where we're not needling sometimes, which is kind of that energy effects we're having on the energy and blood flow in your body. And that subsides as you lay there. Most of the time, you're not going to feel a needle through your whole 45-minute session. I'd say 5 minutes at most. Otherwise, we can adjust that needle and you don't need to feel it anymore. Let's see, for someone who lives out of the state, what is certification to look for when looking for an acupuncturist? So you might want to just do research based on your state. Nevada, I believe, has its own state regulations, such as California. But as I said in the very beginning of my presentation, there is a national certificate that does cover a good portion of acupuncture licenses, and you're able to practice in many different states within the country. Next slide. Okay, I don't think I see any more questions, but I'll keep waiting to see if there's anything else. So I think that's it for me. The next slide here should show point of contact for our office. You can find us on our website at lifepointacupuncture.com and call the office for any questions you might have. I have incredible office staff actually pictured here and an incredible team of practitioners who have similar inpatient experience that I have in treatment specific to oncology care. And you can actually book your appointment online too and read more about how acupuncture can be beneficial for you or even a family member. We're located in Newport Beach over by the airport at 1601 Dove, Suite 260. I think that's it. Thank you so much for having me.
Lauren, thanks for being with us today.
Yeah.
We appreciate you sharing this amazing information. I think acupuncture is always one of those things that we hear about as beneficial, but it's kind of that mysterious service where you're not really sure what's going to happen. So thanks for demystifying a bit for us. All right, everybody, feel free to stand up and shake a leg. We're going to do one more session, and then we will take a break and allow you to grab a snack and get ready for our final interactive session at the end. So I am now pleased to introduce Barbara Leland. She is a certified holistic health coach who's been working with us here in the Cancer Center, providing healthy eating classes for the past few years. Many of you may have had the opportunity to take some of Barbara's great classes, teaching us kind of the benefits of healthy eating, providing us cool recipes. I've had so much fun myself, even trying to make some of the things that she shared with our classes. So we are thrilled to have her here with us to talk about how we might stay healthy after treatment and beyond. Welcome.
Thank you, Kristen. I'm so happy to be here today and to be on this positive, very positive note. And I'd like to go on and next slide, please. So what we're going to be talking today about is staying healthy after treatment and beyond. So some of you are in treatment right now, and some of you are finished. But wherever you are, we're on a healthy path. So next slide, please. You've done a great job throughout all of this, and you're still doing a great job. And you've learned so much about taking care of yourself. I mean, really, you've had some time now to focus on you, right? Next slide, please. And we know that when we eat healthy, that is totally in our control. And it's also one of the best ways to keep ourselves healthy, right? Eating healthy will keep ourselves healthy. Next slide. But there's a lot of confusion about what a healthy diet is. There are so many diets out there, and we get bombarded with them on a daily basis. If you're getting emails, if you hook up to the different healthy eating email notifications, you get lots of different diet information, right? So we have the vegetarian and the vegan diet are really a great way to go, but that doesn't work for everybody, right? Keto and paleo can be effective in some areas, but they're not really what I would recommend for a healthy life diet. The raw diet can be incorporated in a healthy diet. Low carb, again, that kind of goes hand in hand with the keto and paleo diet. The no sugar diet, now I am all about that. But the no sugar diet also includes no sugar from fruit, and I am not about that. So what we've found is the healthiest diet to follow, and is so sustainable for your life, is the Mediterranean diet. Next slide, please. So where is the Mediterranean diet? Is it only in Greece or Italy or France? No, the Mediterranean diet started in the Mediterranean, but it doesn't mean you have to eat falafel and hummus every day. Okay, you can incorporate other diets from other cultures in the Mediterranean diet very easily. The only one that you might have trouble with is the standard American diet, which isn't really a diet, is it? Next slide, please. So here's our Mediterranean diet pyramid. And if you look at the biggest block on the bottom there, that is where we're going to base most of our meals, right? We're going to base it on fruits, vegetables, whole grains, beans, legumes, seeds, and nuts, healthy oils, healthy fats. That's where we want to see the basis of our diet. The next one up would be fish and seafood. And if you are vegetarian or vegan, we can work with that to change it so that you can still have a Mediterranean diet and either limit or eliminate fish and seafood. If you are not vegetarian or vegan, I do recommend fish and seafood to be eaten twice a week. Moderate portions of poultry, eggs, cheese, and yogurt. And of course, if you're vegan, you're not going to have that at all. But you want to, that's moderate, and that's weekly. And then less often, or not at all, meats and sweets. I just want to go back to that weekly moderate portions. Yogurt, I think, is an important aspect of our daily healthy diet, but it does not have to be dairy-based. So we can have many different fermented products, not necessarily dairy. They can be vegan. So don't fret if you're eating vegan. Don't worry. There's lots of fermentation that you can incorporate in your diet as well. So you see, you can adjust this Mediterranean diet to suit your way of living. And then again, I think I said already, less often or not at all meats and sweets. Okay. To the left of our pyramid, we have in moderation wine. There are properties in wine that are very good for you, but you do not have to drink wine to get those properties, because alcohol can be a problem. And we'll talk more about that later. Every day you want to drink plenty of water. You want to stay hydrated. That should be your beverage of choice. And then, well, maybe not all of us, but most of us have a thing for chocolate. And that's great because there's healthy properties in chocolate. But we do want to watch our sugar. And I don't know about you, but just sitting down to a plate of raw cacao is not very appetizing and very bitter. So there are ways to incorporate good, healthy chocolate into our diet without adding processed sugar. For example, you could make things with bananas and dates and cacao powder and mix those together in different recipes, coconut cream, coconut milk, mix those together in different recipes, and you'll still get your chocolate fix, but you won't be having any processed sugars. So, and I want to touch on the bottom, on the little bottom section here. This is not always part of the Mediterranean diet pyramid, you'll see, but it is important. It's important to stay physically active every day. And that doesn't mean you have to go out and run a marathon. And it doesn't even mean you have to work out, an hour a day. What they say is recommended minimum is 20 minutes a day. But what should be done is you should be getting up and moving on a regular basis, every hour and a half max. Move your body, even if it's just walking from room to room to room. Don't be sedentary. Sedentary is the new smoking, right? Not that smoking has gone away, but the sedentary is very dangerous also. So you want to be physically active every day, and that doesn't mean, running a marathon. You want to enjoy meals with others, and that means that has to do with being social and keeping that aspect of your life active. So, we had a hard time during COVID staying social, but we found ways to work it out, didn't we? I mean, we're doing it right now with our Zoom and with our YouTube. Excuse me. And so we need that connection. So keep those connections going. And when you can, try to eat your meals with other people, friends, family, positive situations. Keep the arguments for later or not at all. And eat your meals in a peaceful situation. And it's nice to eat with other people. Next slide, please. And why is the Mediterranean diet healthy? Next slide, please. So the main component, part of the main component of the Mediterranean diet is fruits and vegetables. And they contain high amounts of antioxidants, which we know reduce the risk of cancer. They also are anti-inflammatory, and that reduces chronic inflammation. which is so important to keeping our bodies healthy. Inflammation, chronic inflammation is the root of disease. We want to make sure we don't have that. They're high in fiber, so they're good for weight control. Fiber is good for weight control, which, when we're carrying too much weight, that can also be a cancer risk. And they're also good for cleansing. And we want to keep everything moving, keep everything clean, and keep it right out of our system, right? Also, fruits and vegetables have many alkaline properties, and that helps to keep our gut at a good level of balance of acid and alkaline, and throughout the body too, and that reduces the risk of cancer even more. When we're talking about fruits and vegetables, we want to try to stay as pesticide-free as possible. It doesn't have to be organic. You can go to the farmer's market, ask your farmer, your small farmer, are you organic? Yes, no. And maybe they say no, but we don't use pesticides. It's very expensive to get the organic designation. But if they're not using pesticides, they're your friend, okay? There's also certain fruits and vegetables that matter more. I'd like to see if we could all just always have organic or pesticide-free foods, but it's not always possible. But there are some that you want to really avoid if they're not pesticide-free, and there's some that you could get by with. So a good resource for that is EWG, Environmental Working Group, and they have something that's called the Dirty Dozen. They put up a list of 12 items that are really the worst of the worst. And then they also have something called the Clean 15, which are things that maybe those things are on sale at your market that day or that week or whatever. And those things it's less imperative to have pesticide-free for those. And then they have a whole list of them in between. But they're available at ewg.org, and it's a great organization. I use them a lot, and it changes every year, so you want to make sure you check it every year. It doesn't come out in January, it comes out a month or two after. Just keep checking that to make sure that you don't memorize it from the year before and then keep going, because it does change. A lot of them stay the same, but there are some that do change. Okay, next slide, please. And then another thing about fruit and vegetables is that they contain phytochemicals, which are also referred to as phytonutrients. And what phytochemicals do for a plant is they're a chemical that grows inside the plant that protects that plant from viruses or bacteria, even by some fungus and some bugs. And because the plant itself has that nutrient in it, that phytonutrient, that will help protect your body when you consume it from bacteria and fungus and virus infections and a variety of things. And it's not something that's essential for your life, but it occurs naturally through these vegetables. So that's a great aspect. I see I have a question about the benefits of intermittent fasting. I'll try to get to that at the end. I'm not sure if we have time for that, but let me see if I can get to that at the end. And if not, you can email me and I can discuss that with you. Okay, so next slide, please. This is a listing of phytochemicals, where they come from, the possible benefit, and just some little tips on how you might prepare them. You can download these slides, so you don't need to write this down, but you can download these slides. It should be listed under your YouTube square. And if not, email me later and tomorrow, and I'll send you the slides over. But this is just a good little chart that tells you some information about phytochemicals, where you find them, what they are, and what they can do for you. Okay, next slide, please. How many servings do we need of fruits and vegetables? Well, we need more than you thought, or more than we've thought in the past. Fruits, we want 3 to 4 servings per day. And vegetables, we want 5 to 6 servings per day. And you can have more. You can certainly have more if it's within your, your budget for the day. But for fruit, 1 serving is about like an apple, medium-sized apple, or a peach, medium pear, things like that, about the size of your fist, depending on how big your hands are. Half a cup of fresh, frozen, or canned. Dried or fruit juice, I would not count that personally in my servings of fruit per day. I would use that more as a dessert, for example. At night, sometimes I want something sweet. I'll take some raisins, and not too many, like maybe a tablespoon of raisins, and I'll mix them with some pistachios. And that right there is great because you have the salt. I use the salted pistachios, roasted, salted. I know the raw and unsalted are better for you, but this is my treat. So I'll take some pistachios, some raisins. I'll mix them together, and that'll give me a nice salty sweet treat that satisfies that craving. Also, if you have some nice dark chocolate that's very low sugar, you could chop that up a little bit and add that to it, and you have a nice, really nice little treat. But as far as using dried, I wouldn't want to see you, okay, 4 servings of dried fruit would be a cup of dried fruit. I wouldn't want to see you do that and say, okay, I've had my fruit, okay? And same with fruit juice, because what you're doing in the fruit juice is you're separating out the juice from the fruit, from all the things that are going to help you process that sugar that's in the fruit. And you're just taking basically the sugar. So, and the vitamins, yes, but you're not taking the other things that are going to help your body process the sugar. So dried and fruit juice is not on my, it does not come into my 4 servings per day. Vegetables, 5 to 6 servings, 1 cup of leafy vegetables. Smash that down if you're measuring it. Don't just lay them roughly on top of each other. And that you could get 2 leaves of lettuce and you'll have a cup. No, smash them down a little bit. If they're cooked, frozen, canned, half a cup is a serving. And vegetable juice, half a cup. Again, with vegetable juice, it's better than the fruit juice because it's vegetables, you have less sugar. However, if you're having carrot or beet juice, that could have a lot of sugar in it too, right? So be careful with that. And try to get your requirements through the whole vegetable or the whole fruit. And then if you want to add to that for nutrients, you want to add vegetable juice for more vitamins, feel free. Just watch the sugar content. Next slide, please. And then the whole grains is part of that large block that we're talking about. They have a lot of benefits as fruit does, as being high in antioxidants. They're high in fiber, maybe even higher in fiber than fruits and vegetables. They're good for sustained energy, so they keep your blood sugar levels even. That's important. It keeps your energy going during the day. It keeps your blood sugar levels even, so you're not having these rushes like you would if you were having refined carbs. These are complex carbs. Whole grains are complex carbs, and so it's keeping you level, right? Not like this. Okay, they're anti-inflammatory, so they reduce chronic inflammation, which we've already discussed. And so they're really good for your body. This is why I don't agree with the keto or the paleo diet. Okay, next slide, please. Whole grains. So whole grains, 3 to 6 servings per day. It is not hard to get a serving of whole grain. 1 cup of oatmeal cooked. 1 cup of cooked oatmeal is 2 servings right there. So if you have 1 cup of cooked oatmeal in the morning, or whenever you want to have it, you've already hit 2 servings, right? Half a cup of brown rice. A sandwich on, I like Ezekiel bread. I have no affiliation with them, but I like Ezekiel because they're whole sprouted grains. There's no flour. It's not gluten-free because they are using wheat grains, but because there's no flour, it's better for your blood sugar levels. When you make a whole grain into a flour, even though it's better than white flour, you're still grinding up that whole grain it goes through your system faster. And so it causes a little bit more spike in your blood sugar levels than the actual whole grain would be. You see what I'm saying? When you make it into a flour compared to a whole grain, it's going to spike your blood sugar levels a little bit more. I could get 3 cups of popcorn, air popped, of course. I could get 3 cups of popcorn in a heartbeat. So that's 1 serving of whole grain. So you see, it's not hard to do. And next slide, please. Beans and legumes. So their fiber is similar to whole grains, and they also contain folate, which lowers the risk for certain cancers. And so they have a lot of the same properties as fruit and vegetables. They're antioxidant, they're anti-inflammatory, and they also have the benefit of combining with grains to make a complete protein. If you are a vegetarian or you're vegan, you may not feel like you're getting as much protein as you would like to get. Beans and rice, kind of classic, right? Beans and rice will combine to make a complete protein, and other beans and grains also. And they don't actually have to be in absolutely the same meal. But within a couple of meals, you want to have your beans and rice. I try to do it in the same meal so I don't forget later, what did I have? I had some rice, I had some oatmeal, should I have some beans? I don't know. I try to do it at the same time because I do forget. So next slide, please. And then how many of those should we have? At least 3 servings per week. I think it's super easy to have way more than that. But depending on your diet, at least 3 times a week. And a serving is a half a cup of beans, about the size of your fist. Again, depending on your hand. Okay, next slide, please. And then nuts and seeds. Now, this is good, especially when you're vegetarian, to make sure you're getting nuts and seeds that include omega-3. And we'll talk a little bit more about that in a bit. But walnuts, flaxseed, chia, hemp, all of those contain omega-3. Other nuts and seeds also are good for you. They strengthen your immune system. They're a good source of fiber. They also make a complete protein when you combine them with beans and legumes. So think about a salad with some garbanzo beans and maybe some pine nuts. You've got a complete protein right there. So that's good to know. They have healthy unsaturated fat. That helps to satisfy your hunger. And that's great. And then also that helps to fight inflammation. So next slide, please. And then how many of those should we have? About an ounce a day. Not hard to do. You can see this little chart tells you about what is about an ounce. And that, just keeping in mind, that they are higher in calories and healthy fats. So you do want to keep in mind not to overdo, but do include them in your diet. Next slide, please. Just a note on, well, this kind of goes hand in hand with the healthy fats too. There are things that are higher in calories and higher in fats, and that doesn't mean we should be afraid of them. We just want to make sure that what we're eating, when we're eating these higher calorie items and higher fat items, are quality items, right? That are going to process well in our system. We don't want any saturated fats. We don't want any junk food, processed foods that are going to cause problems. But when we're eating an avocado or some walnuts, you don't have to be afraid of that, all right? Do eat those. So healthy fats include avocados, olives, walnuts, nuts and seeds, right? Olives and avocados are fruits, for example, so they do share a lot of the fruit benefit. So it's like you're doing 2 in 1, right? You're getting the fruit benefit and the healthy fat benefit with one serving. Your walnuts are a healthy fat and they're a nut again, so it's doing double duty. And then the Mediterranean diet does include olive oil, avocado oil, walnut oil in small amounts. Okay, next slide, please. And what's a healthy fat serving? 3 to 4 servings per day. 1 tablespoon of olive oil, avocado oil, blah, blah. But look at you can go to 1/8 cup of black or green olives. You can go to, and it's not talking about avocado here, but we did see in the fruits and vegetables, the size of that. You'd want about 1/4 of a medium-sized avocado is a serving. Okay, if you're looking at that for fats. Okay, I don't know so much about the full fat sour cream or the heavy cream. That would not be my go-to. But a lot of other things, the nuts or the avocados, things like that, are going to be high on my list. Okay, next slide, please. Fish and seafood, like we said before about omega-3s, are very important. They also fish contains vitamin D, B12, which is important, and zinc, and that boosts the immune system. Selenium in seafood boosts the immune system, and they're anti-inflammatory. You want to keep your immune system nice and strong, because what's going to fight off disease if not your immune system, right? Okay, next slide, please. So a note about omega-3. We're getting omega-3 in fish. But what if we don't eat fish? What if we're vegetarian? Omega-3 needs to be in the form of EPA and DHA to be utilized by the body. EPA and DHA comes straight from seafood. Like when you eat fish, you get that EPA and DHA right away. But when you're eating vegetarian products like walnuts or chia, hemp, that is going to be in the form of ALA, and that will convert to EPA/DHA to be utilized, but not as efficiently. So what that means is if you're not eating any fish products, please make sure that you're eating more of the vegetarian items that would be containing omega-3s, so that it'll equal the amount that you need. You see what I'm saying? And you're not going to OD on omega-3 if you're getting it through your food. Now, you could overdo it if you're getting too much omega-3 in supplements. So I usually say I'd like to see you take your nutrients in the form of your foods if you can. Sometimes, now, if you're vegan, you're not going to be able to get B12, and that is important. So if you're vegan, you're going to have to supplement in some way the B12, okay? All right. Oh, one thing also, that if you're eating sea vegetables, so seaweed and other sea vegetables, those have omega-3 in the form of EPA, DHA. So if you're vegan, you want to make sure you're upping your sea vegetable consumption. And there's a lot of ways you can do that. You can do dried seaweed and crumble it into your stews, your beans, you can crumble it just on top of your salads to get a little salty effect. Those sea vegetables are important for EPA, DHA, omega-3s. So that's easily utilized. Okay? I hope that makes sense. Next slide, please. So here are your best, good, and not so great choices for fish. And what this is about has to do with the amount of mercury that you consume. And the bigger the fish, the higher the mercury levels. A great source, and I didn't put it on this chart, but a great source for an app, I believe it comes from the Monterey Bay Aquarium, and they have an app where you can put in the fish, and it'll tell you if it's sustainable, it'll tell you the mercury levels, and it will tell you all kinds of things about that fish. You know, if it's local, if it's imported, things like that. Try to eat wild when you're eating fish, except for, no, try to eat wild. I don't have an except for. I was going to say except for seafood, but no, that's frozen. Frozen versus fresh. Often you have to get frozen shrimp or frozen scallops. You can't get fresh, but do eat wild on all your fish. Okay, all your fish and seafood. Next slide, please. And then do watch, we talked about this already, but it bears repeating because you want to watch your sugar. And the chocolate, again, is good for you. There's a lot of good components in chocolate, but you do want to watch your sugar. So be careful with that. And then in moderation, wine and other alcohols. Next slide, please. So when we drink alcohol, we raise our risk of cancer. And any kind of alcohol. Now we say, well, wine has less alcohol and it has good properties. Well, it does, and it is less alcohol than, say, you're gonna get less alcohol ounce for ounce in wine than you are from, say, whiskey, right? But you're gonna drink more wine. You're gonna drink a glass of wine. You're probably not gonna drink a glass of whiskey. Probably not. So it's kind of the same. You're still getting the same amount of alcohol, really. Let's not fool ourselves. And the less alcohol you drink, the lower your risk of cancer. So just be careful. Know what you're taking in. Okay. Next slide, please. So I love this quote: "Everything in moderation, including moderation." When we are watching what we eat, which we always should be watching what we eat, don't make yourself crazy either. Just adopt a healthy eating lifestyle. Be aware your education is the most important tool you can have. Be aware of what you're eating, but don't make yourself crazy, because we want to enjoy our lives. Otherwise, what's the point, right? We want to enjoy our lives. So if we're constantly worried about what we're doing, it's going to cause stress, right? And that's not good for your body either. So do everything in moderation, but also make that moderation in moderation, okay? Next slide, please. And nothing tastes as good as healthy feels. I love quotes, so I'm giving you a few here. Nothing tastes as good as healthy feels. I don't care. I love ice cream. I don't care how much ice cream or how delicious the ice cream is. If I don't feel good, if I'm sick, that ice cream wasn't worth it. So remember that no matter how good it tastes, McDonald's French fries, whatever, it's not as good as it is to feel healthy or to be healthy. Okay, next slide, please. And this is my last quote. No, actually, it's not. I have one more. Success is a journey, not a destination. It requires constant effort, vigilance, and reevaluation. That is so true. We are not on this path to get to a certain goal. Our goal will constantly be new, right? We want to stay on this path for the rest of our lives. We want to stay on this healthy path. We're not going to reach that destination. We are that destination, right? So we're going to constantly be reevaluating what we're doing. Is this working for me? Is this not working for me? How do I change it up? What do I do here to stay on this healthy path? And I'm going to continue. It's like learning. You don't ever finish learning, right, in life. You're constantly learning. And so it's the same as your path to healthiness, to healthy eating. You want to continually reevaluate. You want to continually learn what works for you and enjoy your journey to it, okay? Next slide, please. And this is my last quote. So eat food, not too much, mostly plants. And Michael Pollan, if you aren't familiar with him, he is a great inspiration. He has some great books and movies out, and he makes things so simple. He's easy to watch, easy to listen to, easy to read. And he, just this right here, eat food, not too much, mostly plants. Okay, that's pretty basic, right? Pretty basic. So next slide, please. If you have any questions, I see there are some questions in the chat, and I will address them now. But if you tomorrow or something, you think, oh my gosh, I wish I had asked that question, go ahead and send me an email at 2life-2health@hotmail.com. I welcome your questions. I do like them. And I like to know what people are thinking. So feel free to contact me. And let me see what the questions are here. Can you discuss the benefits of intermittent fasting? And I think I do have some time to do that. Yes. Okay. So intermittent fasting is another, some people call it a diet, but it really is a matter of letting your body rest and recuperate between eating, right? So you can do intermittent fasting just from stopping eating from after dinner till the next morning. 12 hours is about what they suggest. And it's just a matter of letting your body recuperate and not have to deal with digestion, because digestion can sap your energy. It can sap your everything that is working in your system. All of your processes goes to the digestion. So you want to let your body relax and recuperate. Kind of like muscles, right? Your body needs to recuperate when you're working out. Your body needs to recuperate from digestion as well. So it's a lot bigger story than that. And I'd be happy to talk to you, whoever asked that question, at a later date if you'd like. But for now, just realize it is a benefit, and it can be as simple as just not eating after dinner until breakfast. Give yourself a 12-hour window. Okay. Can you recommend some vegetable juices? Absolutely. Kale juice. I do feel that there are great benefits in beet juice, especially for healing the liver and other items, other things in your body. The liver is really, really well treated by beet juice, but it is high in sugar, so you want to be careful with that. Kale juice. What do you like? Basically, what do you like? Try to get something that has super high nutrients, and so that you can juice it and have it's like taking a vitamin in a glass, right? I don't know what you like, so kale comes to mind immediately, but I have juiced so many things, and I usually add lemon to the juice, always to take away some of the bitterness. And you can really, just kale and lemon will make a huge difference. Celery is super good for cleansing your body. Cucumbers are a great thing to add because not only do they have lots and lots and lots of water in them, they're very cleansing. So when you're juicing, let's say you want a kale, cucumber, lemon juice, that's a great combination. Throw in a carrot, not too much because of the sugar, right? A lot of juices, a lot of times you'll go to a juice store and their base will be carrot. It's a lot of sugar there. So just be careful with that. I hope that answers your question. What are the components, the basic components of the Mediterranean diet? Well, the basic components of the Mediterranean diet is that it's mostly plant-based, but it's not necessarily vegan or vegetarian. It can be, but it doesn't have to be. And the animal products are limited, but also not only are they limited, the ones that you do have are very high quality. You want grass-fed. If you're going to eat any kind of meat at all, you want grass-fed, you want organic, you want free range. Your seafood should always be wild. And you want to make sure that your seafood is going to be low in mercury. So what you're doing is you're bringing in high nutrients, low negativity. So no processed food, no junk food, low sugar, if any. I'm not talking about fruit sugar, I'm talking about processed sugar. Things like that. So those are the basic components of the Mediterranean diet. And another question. Okay, I've heard that whole food, plant-based diets don't include oils. Why does the Mediterranean diet allow it? The whole food, plant-based diet, which is great, is a vegan diet that the reason they don't allow oils is because they don't allow anything that is not a whole food. So if you're taking the oil out of a nut, for example, walnut oil, you're taking the oil out of that nut or out of that olive or out of that avocado, you're separating it from the whole food. There's also the idea that having, and that can they're saying that that can tax the system. There's also the idea of having certain oils are very dangerous for your body. You don't want to, canola oil, for example, which is widely used, is inflammatory because it's almost always GMO. You could have olive oil and you think you're doing it the right thing, but the olive oil could be processed in a way that you don't want. You need to have high quality olive oil, which is going to be extra virgin olive oil, not heated, cold pressed. You don't want to use your olive oil over 350 degrees. So when you see a recipe that says roast at 450 with olive oil, it's like, no, I'm not going to do that. You don't want to do it over 350. And things like that. So you could get toxins from oils that you want to avoid. Do I get enough protein from vegetable sources on the Mediterranean diet? Well, as we were talking before, you can do things. You have to know what you're doing a little bit. You have to just get some education. But basically, you can combine rice and beans and you have a complete protein. Quinoa is a complete protein on its own. So quinoa it's not a grain. It's used as a grain. It's a seed, but it is a complete protein. So right there, you have a complete protein. And there are hemp seed is a complete protein. You can, I think I told you, you can sprinkle hemp seed on your salads. You can use hemp seed in your smoothies, things like that, and you're going to have complete proteins. So yes, you can get plenty of protein on a vegetarian diet and incorporate it into the Mediterranean diet. And is it better than the part of the question was, is it better than animal protein? Well, yes and no, it depends. It depends. Animal protein, it really depends on your outlook on that, but it's a little harder to get all of the nutrients you need if you're vegan, right? But you can do it. The only thing you need to supplement is B12. But you do have to work a little harder to get nutrients from non-animal sources, okay? To get the protein from non-animal sources, but not that hard. It's easy once you get the hang of it. Last question, I believe, is how does wild seafood compare with farm-raised seafood? Hugely. Okay, so wild seafood is swimming in the ocean freely. It's eating the things that it normally would eat as a wild animal. For example, when you go to the market and you see farm-raised salmon, it most likely says, and if it doesn't say, they should be saying it, color added. Why is that? Well, they want it to look as appetizing as the wild seafood does. The wild seafood eats things in the ocean that gives it that color. Whereas in the farm, they aren't eating the same components and they're not swimming. They're not doing as much. They don't have the room, the space. Then on top of that, depending on your source, now there are better farm raised than others, right? So when you see something that says sustainable, no antibiotics, like if you go to Whole Foods, they have better farm raised than maybe some other farm raised products that are very likely imported. But you don't know what kind of feed are they giving them. You don't know what kind of preventive measures they're taking to keep those fish healthy. So as far as like antibiotics and things like that, that Monterey Bay Aquarium seafood app does give you information about things like that too. So there are things about the fish being sustainable and antibiotics and things like that on that app as well. So that is important. You do want to limit it or eliminate any farm-raised fish, okay, or seafood. Be careful with shrimp. When you go to a restaurant and you order shrimp, most likely, because they're not going to spend as much money as possible to give you a dish, unless they're like a farm-to-table restaurant and they're charging you more. Because remember that if it says on the menu, wild fresh, right? They're going to to charge you for that because it's costing them more. So if it doesn't say wild and if it doesn't say fresh on your menu, probably won't say fresh, but it might say wild or not. The chances are is that it's farm raised. And you don't know where that's coming from. You don't know if it's sustainable. You don't know how that is being fed or anything. You just don't know. So be careful when you go out. Shrimp especially can be very, very highly dirty food. So, okay, I think that's it. If there are no more questions, then I want to thank you for being here. I really appreciate everything that we've been doing today. I love the whole presentation. And if you have questions tomorrow, if you can't get the slides, remember you can email me at 2life-2health@hotmail.com. Thank you very much, and I'll see you soon.
Thank you so much, Barbara. That was fantastic. I was making notes myself over here about different things I need to remember when I'm thinking about food. So I appreciate your time with us today and all of your wisdom. We are going to take a break. I'm sure y'all are ready to get up and shake a limb or grab a snack. So it is 12 o'clock now. We're going to break until 12:10. So during that time, go ahead and grab something to eat. Take care of whatever business you might need to, and then meet us back here at 12:10 for our final presentation, which is going to be our art project. So you're going to want to gather the items that came to in your box and make sure to keep your box handy so that we can announce our raffle winner. We will see you back here at 12:10. Thanks so much. Hi, everybody. Welcome back. I hope that you had a good quick break and you're excited for our last session. I am thrilled to introduce Josephina Kim, who is one of our awesome social workers here at Hoag Cancer Center. She's been working with us here at Hoag for over 5 years and has been really an instrumental supporter of our arts program here. So I am thrilled to turn it over to her to lead you in our final session. And I'm going to stay kind of in like the little corner here. So you may see my face for this session as she teaches her class so I can help guide any questions she has. Welcome, Josephina.
Hi, everyone. Welcome today. We're going to do a fun project. You will have received this mosaic kit, and it will include all your supplies. And this is a fun project, so I'm really excited to do this. So maybe before we get started, like how Elaine and Nancy, told us to do the breathing, maybe we can start off with taking a deep breath in, hold it, and exhale. This is something really relaxing, and doing this project is just really helps, decrease our anxiety or any stresses we have. So whatever you have going on, I want you to let that all go and just be really present here with us today. So you will have received this kit, and just to kind of show you, so you guys know what we're doing, this is the final product. So I thought maybe you guys might want to see it so you guys know what it's going to look like. So you'll have, let's take out the supplies. So you will have this little bag of the tiles, and I'm going to just pour them out onto the table. And you'll notice that the tiles are in different sizes and different colors. So there's no clear pattern. It's whatever you want to do. And here's the board. Oh, also we have a raffle winner. So if you look at the back of your kit, if you see 4 stickers, there's going to be a sticker of a heart, a butterfly, a smiley face, and a flower. Go ahead and email Marie, and you'll see her email address in the chat box. So yes, you are the raffle winner, and we will send out your raffle prize. Awesome. Okay, so here's the heart board and your paintbrush and the glue, okay? So just go ahead and open the glue, and we will glue the tile pieces onto the heart. Okay, so what you can do is take the glue and either pick up the tile piece and place the glue on the back of the tile piece and stick it on. And then what I like to do is just kind of push it down, press it down for like 2 seconds, kind of put it in place. And if that's difficult to hold on to the tiles like that, you can go ahead and place the glue on the board. Just kind of paint the glue on, and put the tile on. And again, just hold down and push it down for like 2 seconds. And you're just going to repeat this process throughout the heart. Remember, these are all different colors, so there's no clear pattern. And you don't want to put them too closely together because you're going to be placing the grout in between. So kind of space them out a bit. And also, if you guys have any questions, go ahead and place them in the chat box below. So here, as we're doing this, just a nice activity to do. We're not really thinking about anything that we have to deal with, or whether you're treatment or done with treatment, right? Or worries of the unknown. This is kind of like just nice and relaxing to place these tiles on. And you're just going to keep going on, or putting them on, like so. You see? I'm just going to put some on the board, the glue on the board, Push them down. Just really nice to do. Oops. So it's just really relaxing and kind of fun, right? And just push them down. And they'll already kind of stick, right? Make sure there's enough glue on. I think on some I need to put a little bit more glue. So make sure you have enough glue on to hold them down, or that so that they stay in place. Just keep going. It's just really nice to, not think about anything else and just kind of focus on the art project. And just kind of space them around, not too close to each other. And I know when I did this, I had like just a few tiles left over, maybe like 3. And then on the other one that I did, I used all of them. So you guys may or may not have some tiles left over. And either way, it's fine. Or if you want, you can squeeze some of them in. But yeah, just keep repeating. I think for me, it's kind of easier to put the glue on the board. And then pushing the tiles down in place. Oh, and I also hope you guys put on your Hogue aprons to keep your clothes clean and away from this stuff. And they have all different colors, like yellow, glitter ones, square shapes, triangles. Push it in. Oops. Well, I hope you guys are enjoying this at home. It's kind of nice to hear all the speakers and then do a fun art project. And then just keep going. And then again, if you guys have any questions, put them in the chat box. So this time it looks like I have quite a lot of the tile pieces left over. So I'm going to add in a few more. And if you guys want to do this at home again or at another time, go ahead and just go online and you can order more of these mosaic kits just anywhere online. And you can, order different shapes and stuff and do these at home whenever you want. Okay. So here is mine so far. So here's the heart with the tile pieces. And then at this point, I'm not going to do it here, but I did do this at home. You're going to grab your hair dryer and place it on top and blow dry it. And put it on like a cooler setting and go ahead and do this for about 1 minute. So place the dryer on top and blow dry it, and that will speed up the drying process. But this is what it looks like. And here is one that I did already at home. And this one is dried. And again, about a minute with the blow dryer. Just put it all over, or let the air go all over for about 1 minute on a cooler setting. And that'll speed up the process for it to dry. And yeah, this is what it looks like. So the next, we are going to take the grout. Here's the powder. And I'm going to pour it in the bowl. So here's the grout. I'm going to pour it in the bowl. Then I'm going to mix it. So you want the consistency of peanut butter, it says. So just take about 1 spoonful at a time. Or let's do 2. And then stir. So that's with 2. I definitely need more. And with this, I'm using my spoon, but you can also use the back of the paintbrush to stir it if you don't have a spoon. So that was 2. This is 3, 4. So that's 4 tablespoons, and I'm going to give it a stir. I definitely need more still. 5, 6, 7. And just keep stirring and see how it looks to you. Again, you want the consistency of peanut butter. So not too watery. I think I'll still need more. I'll do 2 more. And then I'm going to keep stirring it. How's it going at home? Are you guys getting peanut butter? Let me see. Okay. I think I'm going to add 1 more. Maybe I'll just do a half. Okay. This looks pretty peanut buttery. So now you're going to take your grout and you're going to pour it over your heart. So with the hairdryer and everything that sped up the process, it should be dry now. And then you're going to pour the grout over, or spoon it on over the heart and place it on top, like so. You're going to spread it evenly across. And onto the sides. So just cover all of the board, the heart board. And just keep covering it over. And what I did was I grabbed a butter knife and just kind of scraped it over the tiles so the tiles can see through. And then also have, your paper towels on hand, so if you need to wipe your hands, go ahead and wipe them. Okay. Let's see. I just kind of scraped it like this. And just kind of go over the tiles a little bit so you can see them through the grout. And just kind of form it along the sides. Take the knife. Smooth it around the edges. And in certain areas, you may need more grout. So just kind of put it on. kind of scrape it so you see the tiles. And some are kind of hidden more under since the tiles are different like shapes and sizes. So smooth it over onto the sides. And can you guys start seeing more of the tiles? And then what I did was take a paper towel and just kind of rub over each tile. So you could see it better. So you can see the jewels. Let's see. So just kind of wipe the grout over each jewel or each tile. See? Get another paper towel. Kind of go over each tile. And then you could see the different colors of each one. And keep wiping over. Like this. And then when that dries, you can paint the edges if you'd like, and that looks like this. And then you have a heart, a mosaic heart. And the paint is included, so you can take the paintbrush that we used earlier, and then once it's all dried, you can paint along the edges, or you can leave it blank. But here's the final product of the mosaic. So I hope you guys enjoy that. And if you guys have any questions,
That is so cute, Josephina. That was awesome. We do have a
Yes,
couple of
thank you.
questions that have come in. So what are the benefits of healing arts for people with cancer? I know we have a few different programs that we offer here at the Cancer Center. And why would someone who maybe not an artistic person want to lean into an art class as they're going through treatment?
great question. So studies show that there's lots of benefits to practicing arts for cancer patients through the beginning, during, and after treatment. It helps reduce symptoms of depression, anxiety. It creates that space to give patients the opportunity to give that outlet that maybe they cannot put their emotions into words. If you do a class here at Hoag, there's that sense of community also, and that togetherness, and it's really just a relaxing thing to do, activity to do, to help reduce our stress. So even like doing the mosaic, just putting on the tiles is just really relaxing in itself.
Honestly, just watching you put on the tiles was relaxing for me. It was kind of meditative. I wasn't even doing the art project. I was just watching you place them individually. So someone asked, do I need an art background or any kind of art experience to participate in healing arts classes? And what if I have zero artistic abilities?
Yeah, you don't need anyone is capable of practicing and creating art. You don't need any, special training or background. It's for everyone. And yeah, it's definitely something that you don't need any skills because anyone can do it.
Okay. And then are healing arts limited to painting and drawing?
No, I mean, of course, it's painting and drawing, and you can also do like play an instrument, music, right? Photography, and those things, like even coloring, just things that you can think. Lots of things are art, right? So it's not limited to just painting and drawing. But yeah, definitely, tap into, like, if you were into photography, that's really relaxing too, musical instruments, music, singing, right? Dancing, if you can. So yeah, it's endless, but everyone's capable of doing it, and it's just really relaxing to practice.
Excellent. I don't see any other questions that have come through. Any final questions that anyone has out there that we might be able to help with before we close for the day? If you do think of anything, or if anything comes up from any of the sessions, we will have this presentation posted on the Hoag Health YouTube channel. So you will be able to find that there if you need to go back and revisit any of the instructions that Josephina gave for this project. So thank you so much for joining us, Josephina. We appreciate having you here today and your expert guidance on our mosaic.
Thank you. Thanks, everyone. Enjoy.
So just a final word of thanks to all of you for participating with us today. We do desperately look forward to being together with you in person, hopefully at our next annual symposium. In the meantime, if you have questions or if you need guidance for any part of your cancer journey, please feel free to contact us directly at the Cancer Center, and we will do our best to help get you whatever services, resources, support that you need. Thank you so much for being with us today. Have a great one.